Get updated on the latest news on health in and around the Philippines by visiting our official website, www.radiokalusugan.com. Get to listen to Radio Kalusugan 24/7 in high definition. Get the latest update on our current and upcoming activities. Read various health tips and trivias. Buy and get discounts on all Radio Kalusugan products. Our website is jam-packed with information, news, and awesome content in health and more. Give us a click today, www.radiokalusugan.com. The podcast edition of Kalikasan Kalusugan is also available worldwide by visiting radiokalusugan.podbean.com. You may also listen to all our podcast shows direct on our Facebook pages, but available only for laptop and PC devices. Kalikasan Kalusugan and other Radio Kalusugan podcast shows will soon be available globally on Spotify, Amazon Music, Google, and Apple Podcasts. Kalikasan Kalusugan is shared and streamed live to more than 3 million combined followers on Facebook and YouTube, powered by IBS Media. Just look for Radio Kalusugan on Facebook and YouTube to watch our previous program, including Kalikasan Kalusugan. Please don't forget to follow, subscribe, share, click the bell button, and get notified when any of our programs go live. Radio Kalusugan is the first health-focused radio in the country, and you can catch Kalikasan Kalusugan soon for free on your radio sets over DWCO 103.1 FM across Calabarzon region. Radio Kalusugan 103.1 FM is a proud member of the KBP, di kapisanan ng mga broadcasters ng Pilipinas. You can listen to Radio Kalusugan via online anytime, anywhere in the world using your smartphone, tablets, laptop, computer, and smart TV simply by typing "Listen to Radio Kalusugan" on Google search. Download our exclusive radio app on Google Play and Apple Store. Radio Kalusugan is also available on radiophilippines.com, MyTuner, radio.com, streama.com, radioline.co, and the website of KBP Calabarzon. You may listen to us by visiting our website, www.radiokalusugan.com. Radio Kalusugan Online is available 24 hours a day in standard and high definition formats. Partner.
Magandang araw sa lahat ng sumusubaybay sa aming programa. Luzon, Visayas at Mindanao, pati na sa ating mga OFW sa iba't ibang dako ng mundo. Magandang araw sa ating lahat. At ang programa namin ngayon, ito po ay aming gagawin sa pamamagitan po ng streaming, at kasama namin si Dr. Alan Landrito mamaya at saka si Sir Manuel Gonzales. Ang tatalakayin po namin ay ang tungkol sa prostate at saka sa diabetic mamaya. Okay, magandang araw sa lahat. Partner, kumusta?
Mabuti naman. Pwede mo bang ipakilala yung ating magandang lalaking guest natin ngayong araw na ito?
Oo, bago ang lahat, pakilala muna welcome muna natin si Dr. Alan Landrito, yung humble doctor natin at napagkahusay at kahit sa napagkaraming gawain ay patuloy pa rin na sumusuporta sa atin at sumasama sa atin para makatulong sa ating mga mamamayan, hindi lang sa Pilipinas pati sa iba't ibang dako ng mundo. Doc Alan Landrito, welcome po.
Kalusugan, no? Sa ating mga listeners.
Ayan, gandang hapon.
Doc.
Doc.
Nandito na naman ako. Kasama niya ako.
Okay. Magandang hapon, Doc. Ay, Doc, ipaano pala sa inyo, nandyan pala si Sir Manuel, makakasama natin ngayon at na-invite din natin dahil ang pag-uusapan natin tungkol sa prostate. Kasi si Sir Manuel, may prostate din siya. Yung na-testing niya mismo sa sarili niya, yung ivermectin. Kaya nais din natin siyang makasama.
Yeah. 3 months ako nagkausap nga kami. Nagulat siya kasi nag-take siya ng... Ito na pala nandito si Manolo na lang ang magpaliwanag.
Okay,
Hello,
Sir Manuel
Gonzales, how are you?
Good afternoon, everybody. Good afternoon. Thank you for asking us over. Itong si Dr. Landrito, yan ang hero nating lahat.
Yes.
Yan ang nag-umpisa sa atin. Yan ang nagbukas ng mata sa dami natin mga Pinoy. Hindi lang mga Pinoy, pati si Dr. Landrito, pati mga doktor sa India, kilala na rin niya. Nag-usap na kami, nag-conference kami sa mga Indian. Anyway, sa madaling salita, no? Isang beses nakinig ako kay Dr. Landrito sa isang mga conference na sinabi niya na madaming mga kaso dyan na ginagamit yung ivermectin para sa cancer. So, dito sa grupo namin ng IPK, yung grupo ng IPK, doktor yung kasama ko rito, no? 11 na doktor. So, anong nangyari dito sa grupo natin? Nag-exchange kami ng information. So, we read studies and we pass it on to the group and the group discusses it, no? And as a result of this, we start investigating on our own. So, nagbasa ako na pwede pala itong ivermectin sa cancer, no? So, nagbasa pa ako. Sabi ko, baka pwedeng gamitin to sa prostate. Kasi yung prostate ko, anong tawag sa prostate sa Tagalog? Anong name ng prostate sa Tagalog?
Pantog.
Prostate yata
Prostate ba?
Anyway, it turns out, yung pala, tayo mga macho, yung mga lalaki, 50% may problema tayo sa prostate. Hindi lang natin alam, pero may problema tayo. Paano natin nalaman na may problema tayo? Yung pag-jingle natin, nahihirapan tayo. So, in my case, no, every night, 3 beses ako gumigising, no? Every night. Tapos pag jingle ko, konting-konti lang, patak-patak lang, hindi malakas yung agos, no? So sabi ko, kailangan mag-eksperimento ko nito. So kinonsulta ko si Dr. Nandito, ano naman pwedeng tirahin to? So sinabi niya sa akin, the dosing is 0.3 to 0.4. So nagbasa pa ako ng konti to see kung it sounded correct, no? And sabi ko, this is about the right dose. So, I tested myself for 37 days. But before I tested myself, ang ginawa ko, kinuha ko yung PSA ko. Yung PSA is a blood test that determines if there is something abnormal with a possible abnormal growth with our prostate. And in my case, ang PSA ko mataas, super mataas, no? So,
Anong reading?
I have had my PSA reading 13 plus, 16 plus. So, pag tinignan mo yun, mukhang cancer na yan. Mukhang cancer na yan.
Yes.
Pag ganun kalakas yan, kailangan, the urologist will tell you, you go and get yourself a biopsy. No? So, nagpa-biopsy ako. Yung biopsy ko, salamat sa Panginoon, negative, yun lang, mataba lang siya. Malaki yung prostate ko. So sinabi ko, titirahin ko itong ivermectin na to. So tinesting ko yung sarili ko. So I tested myself and I was taking an average of 0.3 milligram per kilo per day. No? In my case, medyo mataba ako, so I have to take 2 pills a day. So after 8 days, napansin ko, imbes na 3 times a night ako gumigising, once na lang.
Wow.
So, tinuloy ko yung ivermectin. Pagkatapos ng 18 days, hindi na ako nagigising sa middle of the night. Paggising ko sa umaga, after 7 hours of sleep, pag jingle ko, gulat ako. Yung stream, yung agos, para akong bata. Hindi naman ang batang-bata, pero solid yung malabas na ihi. Solid.
Yeah.
Anong ibig sabihin dun? Ang ibig sabihin dun, gumagana yung ivermectin. Ngayon, hindi ko pa alam kung yung prostate ko lumiit. Pero sa tingin ko, lumiit. So, ang ginawa ko, nagpa-testing ulit ako ng PSA. So, yung dati yung PSA ko that before the start of the ivermectin was 6 something. Pagkatapos ng 37 days, yung PSA ko naging 4.5 something. So halos normal na yung PSA ko. So yung tingin ko, aba, okay to, gumagana siya. So inisip ko, I need to make this an experiment. We have to make a big experiment. Because kung sa akin lang yan, walang ibig sabihin. Pero if we make a big experiment and we ask other people to do like me, other people with problems to do like me, then we can find out if truly the ivermectin helps shrink the prostate. So that's one. Ngayon, so ang ginawa ko, nagtayo ako ng bagong Viber community trial ang tawag na. So, dito sa trial na to, we are inviting everybody who has a problem with the prostate. So, kung nahihirapan kayong sumingil, sumali kayo sa amin, mag-testing tayo, tingnan natin kung gagana yung ivermectin sa akin. Ngayon, dito sa may problema sa prostate, okay, hindi lahat enlarged lang. Yung iba, may cancer. Okay? Explain ko ng konti to. Yung cancer, minsan, nandun lang siya sa loob ng prostate. Kung ganyan yung cancer natin, it's bad, but not too bad. Ang problema kasi sa prostate cancer, hindi laging nandun lang siya. Sometimes, yung cancer na yun, lumilipat sa ibang lugar ng katawan. Doon ang danger. Okay? Ngayon, sa mga cases nito, okay, we also have to experiment if the ivermectin can work. No? Ngayon, yung dosing ng mga cases na to, na alam na natin na naglipat na yung cancer sa ibang lugar, kailangan pag-aralin natin din yan. No? And this is why in the group right now, as of today, kahapon ko lang binikas yung community group, there are already 15 different doctors. And yung mga doktor natin, hindi lang Pinoy. Meron mga doktor galing sa Amerika. So meron na kaming 3 doktor na Amerikano na tinetesting na natin yung mga ibang patient nila, no? So this is going to be, habang it's a community trial, we're already going to get some people from other countries. So this is why it is very important that you come. It's a very simple, merong questionnaire na linagay natin, no? It's a preliminary questionnaire, so that we're able to answer, we're able to study each case, no? And it's looking really promising. Meron ng mga ibang kasama natin sa community nagsabi, for example, yung mga comment nila is, nag-umpisa na ako, 6 days pa lang, nakita ko, no, gumagaling na yung agos ko. 6 days of ivermectin, no? And the standard dosing that we have arrived at, I have made a chart para simpleng dosing, is between 0.3 to 0.4 milligram per kilogram per day. So, if you weigh, pag ang timbang mo 50 kilos, ibig sabihin dun, pitong ivermectin 15 milligrams pills ang iinumin mo per week. Yun lang, ganun lang kasimple, no? At saka yung payo lang natin is, kailangan inumin yung ivermectin pagkatapos ng breakfast, okay? Kung maaari, may konting kasamang virgin coconut oil, konting, maski lang 1 teaspoon lang, para yung absorption ng ivermectin maganda, no? So, and the idea is, you can do this for 20 days, 30 days, whatever you like, and we will see, no? And we will collect the results and share the results with everybody. But it looks very promising, no? And we are so excited because, remember, itong ivermectin na to, simpleng gamot, murang gamot, walang patent, hindi ko makita yung mga malaking kumpanyang pharmaceuticals. Kung may demonstrate natin na gumagana siya sa cancer, ilang libo-libong milyong tao ang, we're going to be able to help. So this is so important for all of us. It just may turn out that ivermectin will become like an aspirin. Like an aspirin, yun ang pinaka-importanting gamot sa mundo. Ganun ka-importante yung ivermectin sa inyo sa tingin natin. And then I would like to add, meron pa kaming isa pang gamot na ginagamit namin. In the group of IPK, nag-eksperimento kami, no? So, we recently experimented with Benadryl and lactoferrin. Nakita rin namin yung epekto parang ivermectin din, para sa COVID, no? So, dito sa sa Spain, wala akong masyadong ivermectin. So merong mga kaibigan nagkasakit ng COVID. Pinainom ko ng lactoferrin at saka Benadryl. Aba, the next day gumaling lahat. So what we're seeing is that there are other medicines or supplements or vitamins or whatever na baka makatulong din, no? So we're also now doing a lot of research on lactoferrin for its effects on cancer. Because sa tingin namin, baka pwedeng i-join yung dalawa, yung lactoferrin at saka yung ivermectin para sa mga cases na yung cancer nag-spread na sa ibang organs ng katawan. But of course, this is just right now, we don't know yet. We're just experimenting at this point. Now, yung trial namin is completely voluntary. We just suggest kung anong pwede and we observe. It's an observational study. So you're all invited to come and join the study with us. And Fernando Boyles is helping us also because he's giving free ivermectin care of Dr. Landrito for all of the people in the Philippines who want to join the trial. So for the meantime, meron tayong gratis na ivermectin. Salamat kay Dr. Landrito. So this is talagang pasalamat tayong lahat kay Dr. Landrito.
Basta dito sa Pilipinas, Sir Manuel, free ivermectin for 1 month. Yung last ivermectin nagagaling po kay Dr. Alan Landrito. Ako mahala sa shipping kasi si Doc Alan, gusto niya Doc Alan na makatulong sa lahat. Kaya para matugunan yan, dahil maraming tao na walang kapos sa pangbili, mayroon namang may pambili pero nag-alangan. Kaya ginawa ni Dr. Alan para makatulong, nililibre yun sa lahat ng may cancer.
Maraming salamat Doc Alan for this initiative, no? This is so important for all of us. Aren't you proud to be Filipino? Doesn't that make you proud to be a Filipino? Doesn't that make you feel proud to have been born in the Philippines, raised in the Philippines, met so many people in the Philippines, and to see how many Filipino great people we are? Thank you.
Yeah. Aren't you Spanish, Manolo? Or
no, I was born and raised in the Philippines. Ibig sabihin, natural born, natural raised. Anong ibig sabihin dyan? Di Pinoy, hindi ba?
Yes. Pwede ka tumakbo ng presidente, natural born.
Siyempre, natural born, natural raised. Maski na Kastila ko, yung upbringing ko, Filipino. Pag tinanong sa akin, no, dito sa Spain, no, tinanong sa akin, tiga saan ka? And natural ako sa Pilipinas. I am a natural born from the Philippines. It's the truth, di ba? So ano sasabihin ko? Hindi, yung nanay ko Kastila, yung tatay ko Kastila. Hindi, saan ka nanganak? Di ba? Saan ka nanganak? Saan ka lumaki? Meron akong kaibigan from Cuba. Cuban. Inchik. Nakakatawa kasi pag kausap mo, yung salita niya, Cubano. So, hindi mo maintindihan how can somebody Chinese talk like a Cuban? Yung pala, Cubano siya. So, it's not what we look like, but where we are born and where we are raised. Di ba? Yun lang.
By the way, Manuel, I would like to add, in my case, actually, because I've been taking ivermectin for almost more than a year, actually. 1 or 2, but much later, ng ilang buwan na siguro, mga 4 or 5 months na siguro, I've been taking almost 2 capsules. Just for prophylaxis on everything. Actually, it's more on prophylaxis on cancer, because we are already in a certain age that we have to worry about cancer, no? That anything can pop up. But anyway, I always have my what you call this ultrasound every year. So full abdomen. Last June, just this June, I had my ultrasound. And the technician there in charge told me that your prostate has shrunk, but konti. So when you said that, I can relate it to myself. However, Doc, I remember yung doktor ko sa
Hindi ako
prostate
doktor,
noon.
Hindi,
Excuse me.
hindi ako doktor, ha? I am
Yeah,
not a
I know.
doctor. I am an
No,
engineer.
I know. I'm referring to Doc Landrito.
Landrito,
Na
yeah.
pagka nag-shrink daw ang prostate mo, baka may problem ka ng tumor sa pituitary gland. I remember that sinabi niya, I don't know, is that true? Doc L. Landrito?
I don't know about that kasi there's no loop or what you call control by the pituitary on prostate. Unlike other organs, like the ovaries and the adrenals, may control siya. And the thyroid.
Okay.
Pero prostate, I don't know. I'm sure there's not. No? Pero I don't know how it relates with the pituitary.
So, that's why hindi ko masyado inano yan na pinansin kasi baka hindi magandang, it could mean different thing. But precisely, based on the urination problem and etc., it really greatly improved. Totoo yun, no? Nag-improve talaga. So I have no quarrel with that na I agree na yung sinabi mo nag-improve yung iyong urination pattern. Tapos dati talaga minsan talagang meron kang tinatawag na dripping urine, no? Urination. So ngayon talagang ano siya, dire-diretso siya. So I can really relate to that experience mo because nangyari sa akin 'yan. And yun na nga lang yung question about kung lumiit ba. Hindi ko po mabasa ngayon kung ano talaga yung iniliit niya, pero lumiit daw siya without me asking anything. Sabi niya, lumiit yung prostate mo, kaya lang konti lang. So,
Jill,
that could be a sign, ano? I don't know what does it mean, but there is a sign.
Jill, what we're doing here in our study, ideally kung sana, no, kung pwede, no, is everybody will make a PSA test before and after the ivermectin trial. Everybody will make an ultrasound test before and after the ivermectin trial. And everybody will make a before and after enzyme test to see if the liver function is the same. So that's the ideal kung pwede, no? But of course, hindi natin pwedeng gawin sa lahat, no? But we will try to do this in as many cases as possible so that we're able to establish a real benchmark na nag-shrink talaga yung prostate, no? And in the case of the cancer patients, for example, people who we already know na nag-metastasize yung cancer sa ibang lugar, no? For example, meron na silang problema sa bone scan, no? We will also try to make a before and after, no? Karamihan, but of course these are expensive. Medyo mahal itong mga test na to. Hindi natin pwedeng gawin sa lahat ng tao, no? But some of the people who will be joining in our test will be able to do this, no? So doon natin makikita kung epektibo yung ivermectin para sa cancer, no? So if we're able to see a change in the amount of cancer spread, no, or we have other cancer indicators na blood test, that would give us an idea na talagang gumagana yung ivermectin para sa cancer. There is another thing I wanted to add, no. Sa karamihan ng mga nabakuna na yun sa Pilipinas, at hindi lang sa Pilipinas kundi sa buong mundo, hindi natin alam kung anong epekto ng mga bakuna sa mga cancer. Hindi natin alam kung ang mga bakuna will cause people now to generate faster cancers. I say this because dito sa Spain, no, meron akong dating tinatrabahoan, we were about 30 employees, puro mas bata sa akin, lahat sila. So, in this year alone, 2 sa kanila, nagka-cancer bigla. Puro bakunado sila. Yung mga kaklase ko, high school, all of a sudden, 2 may cancer sila. So, hindi natin alam kung yung pagbabakuna is affecting the amount of people with cancers. No? But this is something that we have to also start looking. No? And maybe because of this, it is important that we start reviewing to see how our prostates are coming along. So it's a study that hopefully we can get other people to join with us and we can learn. No?
Actually, Manolo, in our experience here in the Philippines, we are seeing a lot of cancers coming from the vaccine. Although we can establish causation, but the numbers are showing, no? And yung occurrence, bakit ngayon pa nung kailan nag-vaccine dahil biglang lumabas? And the kind of cancers we're seeing, for example, these patients totally wala silang history ng cancer. And they got the vaccine, then suddenly they have cancer. Pero ang cancer nila, advanced kaagad. It's stage 4 kaagad. Ganyan ang mga nakikita natin dito sa Philippines. No? So, of course, it's very difficult to establish causation. And the people who are giving the vaccines, they will deny.
Siyempre. No, but this is why now our study has even more importance, because if we find that ivermectin is able to maybe not even cure, maybe just stop or maybe just delay, we would have already gotten a long way. It's already an improvement. So this is why I invite everybody to join us and come over to try. We may just find the cure. Earlier we were discussing with Jill and Fernando, not Fred. We don't know how God works. This pandemic, baka this has enlightened all of us to try and experiment with other things, and we may just find out that ivermectin is a cure for many things. So we have to be very thankful.
You have to hear what we were discussing last Wednesday. We had this Radio Kalusugan. After that, we had the meeting after the show, no, the radio show. 3 of us. You should hear what these guys were telling me about our cancer program. No?
Yes.
Kasi ganito, I have to correct Fred. Hindi 1 month lang binibigyan natin free. We will be giving free ivermectin to people hanggang gumaling yung cancer lang hanggang all throughout. No? And you should hear, Fred, can you tell Manolo here, Jill also, can you tell Manolo ano yung naging feedback natin, what kind of cancers we got, and how much they were taking, and what were the results? Just give a few examples.
Okay, mauna ka Fred, partner.
Sige. Yung sa akin naman, marami talagang sa mga breast cancer, marami ang nagsasabi na yung dating tulad nung taga-norte, sa may Isabela, ang nagnanana daw yung breast niya. Pero nung nag-inom na siya ng ivermectin, pero ang pinapainom ko, 3 capsule, 3 times a day, natuyo na at hindi na kumikirot sa gabi. Oo. Sa Mindanao naman, sa Zamboanga, mayroong nag-ano din sa akin, 3 capsule, 3 times a day din, ay gumaling na rin ngayon. Mayroon din kami dito sa NCR na binigyan namin, kaya lang, itinago, noong gumaling na, nawala na sana yung sakit, itinago nung anak, noong bumalik ang sakit, tsaka uli niya pinainom. Nawala na rin uli ang sakit. Nakasalukuyan ngayon. Kaya marami na kaming record na ang ivermectin, epektibo doon sa breast cancer at saka sa mayuma. Yung,
Fred, this is very important that these cases you also document it. Exactly like you explained. We have to make it, so it sounds scientific, so that the other doctors are able to see it. No? So we have to say, person's initials, weight, age, height, what kind of cancer, what is the dosing, so that we're able to see, because three pills a day is quite a bit of, and we have to say what is the duration you're given the treatment for, no? At saka ano yung resulta. So these are very important case studies, because they're going to this is going to generate even more interest and allow us to arrive at a better, more precise dosing. Because right now, the dosing, hindi pa natin alam kung paano karami ang kailangan bigyan, no? But this is so important because it also I'm thinking in Spanish, I'm trying to look for the word. It gives the person who is taking the medicine the peace of mind that he is not overdosing himself. Kasi may mga takot pa yung tao na baka ma-overdose ako dito sa ivermectin, no? And they don't know how safe it is. So, yung example mo na 3 ivermectin pills a day for, sabihin natin, 20 days or 30 days, medyo matindi yung dosing na yan. No?
Ang binibigyan lang po namin yan, Sir Manuel, yun yung medyo malala na.
Yes.
Pero yung mga bukol pa lang, 1 capsule, 2 times a day. Yun ang ibinibigyan namin.
That's exactly how I think. Yung mga kaso namin sa Amerika na yun, no, na puro may mga metastasis. These are people that have to take already yung 140 pound or 65 kilo person, kailangan 20 pills a week na yan. Medyo mabigat na yan kasi, you know, we wanted to really stop it, no? And we want to see it. So, but please write about these cases. You put those cases, yung mga ilan dyan, document natin. This is so important. Please, Gil, let us know your cases.
Yes.
Manolo, actually, this is what we're doing. Kasi wala namang protocol or established dosing sa cancer. So what we were saying, based on what we had experienced during the pandemic when a lot of Filipinos were only having ivermectin at their disposal, so they were taking ivermectin, staying at home. Of course, they couldn't go to the hospital because there are no available rooms and all that. No? Some people even went severe and they were taking, and they were asking me, how many are we going to take? Before I was coaching them, sige, ganito, then tomorrow increase mo kung walang effect. And so, until some people went on their own, kasi they were panicking, they were severe, hindi sila makahinga. They were taking too much. What we thought were too much for them, that is the dose that they were responding from, and they were getting.
This is correct.
So based on that experience, and based on the experience, like for example of Dr. De La Cruz, she was taking. Can you imagine this? No, she has a fist-size gallbladder cancer.
3 kilos. 3 kilograms, Doc.
Huh?
3 kilograms.
Yeah,
It's a 3 kilogram tumor si Aisha, Dr. Aisha.
I don't know about that, no, pero siguro naman less kasi size lang eh. Pero she started taking, when I talked to her, when we were both guests in Talk to Doc, it's another radio program in Batangas. When I first saw her, nakita ko, naka-cover pa yung head niya kasi nagkikimo siya. She's losing her hair. Pero she quitted that program, that chemotherapy, and I told her, why don't you try ivermectin, because this has anti-cancer property. And she's a doctor herself. She dosed herself, no? So she went to the point of dosing herself 8 capsules a day. So that 8 capsule is, let me check my mathematics, no?
4 months.
4 months yan, 4 months. Na 8 capsules.
That's 120 milligrams a day. Okay? And it's about...
That's she's taking 2 milligrams per kilo per day.
Per kilogram, yeah.
2 kilograms per kilo per day during 4 months. See?
Not 0.2, but not 0.2, but 2, yeah. 10 times the regular dose, no?
Doc Anan, this is a very important case. You know, that's a case that we have to talk. We're talking of a case with cancer, you know, 2 milligrams per kilo per day during 4 months.
For 4 months, and then she reduced this to 6 capsules.
6 capsules, another 4 months.
For another 4 months. And then...
This is a wonderful case. This is a wonderful case. And
what
happened to her gallbladder? Nawala.
Yeah, her gallbladder tumor was shrinking, and then nakita niya, she has no need for that high nilesen niya, ginawa niya 6 for another 4 months, and then 4 capsules for another 4 months. And then the last ultrasound she had, there was no more tumor.
Incredible. Wow.
In 1 year.
There were previous works on that, no? Yeah.
Mga 1 year, Doc.
Yes.
1 year yan.
These kinds of data.
This is so important.
This doctor was taking it for 1 year. And there was no toxicity issue. Di ba? So we are not afraid of giving, kaya sabi ko, you take, anong dose? The high enough dose. That dose that you tolerate, that dose, the maximum dose you can tolerate, you take it, then there we are. And now we are seeing it. Itong ginagawa namin sa cancer, preliminary lang to, Manolo, ha? Later on, pag if I'm convinced na talagang it's working, then I will do a controlled study with all the, yung sinasabi po ninyo na before and after test and all that. Tsaka yung...
Let me just, if you will just repeat the dosing of this doctor. She was taking, you were saying, a day?
Yeah, 8 capsules, that's 120 milligrams daily for 4 months.
And then it became 4, and then it became 4, and then it became 6.
4, which is 90, yeah. It became 6, which is 90 milligrams daily for 4 months. Okay. And then it became 4.
Yeah,
4 months.
For 4 months.
And
after that, her gallbladder tumor disappeared.
Totally, you can find in the ultrasound. And until now, she's taking 2 capsules daily. Just
Yeah.
to.
Kaya ngayon nga, kaya ang initial na binibigay ko, Sir Manuel.
Question lang.
Okay, sige.
Can we have this doctor write her own
She should be.
history?
Yeah, she's with the CDCPH actually.
Okay.
I will
Because
tell
this-
her when I meet her.
Yeah, because
Right.
this testimony has to come on the community Viber so that people see it. That's a wonderful testimony, especially from a
Yeah.
doctor who's done it on herself. Di ba?
Yeah. And she was
Galing.
helping a lot of COVID patients during the.
Who is this doctor? Well, you just tell me later
Yeah.
who is this doctor later. You just tell me who she is.
Yeah.
Wait,
Yes.
we don't identify her on the air.
Yeah, she doesn't mind getting identified because she's during the CDCPH huddle she was there. And
Who is
she
this
became
doctor
her-
then?
Dr.
Sino
Aisha de la Cruz. Aisha de la Cruz.
Hindi lang nila pinagsalita ng maigi si Dr. Aisha doon, Doc, ng
Super.
CDCPH eh.
Super testimony to.
Kaya ngayon, Sir Manuel, ang ginagawa namin ni Sir Jill, kapag mayroong cancer patient na nung nakalipas yung mga breast, kailangan kinakausap muna namin kung anong sitwasyon niya, kung buko lang, binibigyan namin na mas mababa. Pero kapag medyo malala na, doon na namin binibigyan ng 3 capsule 3 times a day. Ngayon, sa tungkol naman doon sa sa Viber nyo, na sinasabi kong 1 month na free, kasi gusto kong malaman muna kung anong resulta sa kanila. Kaya ang pinapadala ko yung pinadalan ko na yung mahigit 20 person ngayon, this day 6 blister lang. Kasi titingnan ko muna yung reaction, titingnan ko muna yung resulta.
That's perfect.
Pagkatapos
Fred,
sinasabi ko sa kanila na tumawag sila uli o mag-message uli para dagdagan natin kung sakaling kailangan pa natin. Sinabi ko, huwag mong hinayang na i-overdose dahil para sa kalusugan.
Fred, I will write about this thing that you just said, no? Isusulat ko doon sa community para malaman ng tao paano yung mode of attack natin. So that will be the support. So I'll write about it, no? Para maganda. And that's exactly that, because that's exactly the idea that our doctors have. Kung nag-uumpisa lang, konti lang yung ivermectin.
Yes,
Pero kung matindi na yung titirahin na natin, di ba?
Yes.
Wait. Let me clarify this. Not all types of cancer will have the same dosaging. Okay?
That's correct also. Yes.
Okay, now, this is what I do. Pagka meron ng problem, mga cases na mga ganyan, like a diabetic amputee, naputulan ng paa, hindi gumagaling yung sugat for 5 months, or stage 4 breast cancer, nag-metastasize na, there is no established dosaging. That's one, no? Okay? But I know a certain, I called effective rate, which you cannot go lower. Otherwise, if you start on 1 capsule or 2 capsule, whatever is that, it may not give you the desired effect, and then maano yung tao, yung bang mawalan ng gana. Kung hindi mo epekto ng isa, dalawa, iinom pa ba sila ng 4? Siyempre, hindi.
The problem, Jill, if we do that, they're going to say that ivermectin is not effective.
Okay.
This is very important that we get the right dosing.
Okay, so that's why I have to clarify this. Okay, now there is a study about colorectal cancer, so in vitro, and they found out that 30 microgram per kilogram body weight ang requirement niya na bago siya mag-react sa ivermectin. Now, this is what we call dose dependent. There are types of cancer that are called dose dependent. Meaning to say, kung isang kapsula lang, walang epekto siya. 2, wala. Pagka binigay mong 4, saka pa lang siya epekto. Pero may mga cancer naman, tulad mo sinabi mo nagsisimula pa lang, na pag uminom ka ng isang kapsula, meron ka ng discernible na effect. Medyo gumaganda na, pwedeng 2, mas better, and faster, and 3, and so on. But there is a difference between these so-called different types of cancer, which has the so-called dose-dependent. So be careful about this dosaging.
Let me ask you a favor.
Okay.
Can you write about that what you're just telling us, sulat mo, kabit natin dyan sa community because that's very important information. That's wonderful information.
De,
So you write-
actually, magmi-meet
Sulat mo.
pa kami ni Doc. Actually, magmi-meeting pa kami nila Doc at saka si Aisha to actually make this more formalized with all the observation that we have.
But you can already explain the concept. Tama yan eh.
Yes.
Tama
So,
yan. So,
that-
bigyan mo just give us a primer. You know what I mean? Yung parang primer lang. You know what I mean? Because that's a very important explanation. Because that's exactly what you're explaining is what we have learned in the treatment of COVID.
Okay.
In the treatment of COVID, that exactly is what we've learned.
Yeah.
There are some cases that are very dose dependent. And there are some cases na hindi masyado. For example, sa COVID, pag inabutan mo yung pasyente na late, kailangan ang dami mo nang bibigyan ng ivermectin eh. Huli ka na eh.
Precisely.
You know?
Precisely.
So this is the same thing with the cancer. So if you can, Jill, I invite you to join our community and just write a primer. You know, just what you just explained it, like exactly like you explained it. It's a beautiful explanation that anybody will understand. You know, because
Okay.
this is so important.
Okay. By the way, Doc,
At saka may natuklasan din ako ngayon sa ivermectin kasi ako nung naglaro kasi kami ng basketball, sabi nga ni Doc, hindi na dapat ako maglaro ng basketball eh. Kasi nga ang totoo 103 kilos ako eh. Oo, nabali yung dalawang daliri ko. Yung isa talaga balat na lang natira eh. Pero hindi ako pumunta agad ng doktor. Ang ininom ko kaagad ivermectin 3 capsule. Pero doon ko nakita na yung sakit nababawasan. Nababawasan. Oo. Tapos yun lang ang iniinom ko. Simula nung binigyan ako ng yung epinamic na ibinigay sa akin ng doktor, hindi ko na inom. Ang ininom ko ivermectin lang, pero 3 capsule a day. O 3 capsule, minsan nung kasalukuyan, 3 capsule 2 times a day. Kaya nakikita ko rin yung epekto na nakakabawas siya ng kirot. Hindi nga kumikirot sa gabi. Sabi nga ni Sir Jill sa akin, nung nakita niya na hindi ko na tinatalian kasi gusto kong makasingaw yung daliri ko. Dahil nga, siyempre, nagdugtong na. Ayun. Sabi niya, hindi pwede. Dapat doon talian dahil mababasag pa rin yun. Mamano yung buto ko. Doon ko nakikita sa experience ko na napakaganda ng ivermectin kahit sa sugat, kahit sa buto, napakadali. At saka mabilis siyang humilom. Mabilis siyang humilom. Oo, ngayon isipin mo, balat na lang natira ng isa, dinugtong ko pa yun. Hinugasan ko lang, nagpabili lang ako ng yung 0.9 na saline solution. Yung
normal saline.
yun ang pinapabuhos ko, tapos idinugtong ko hanggat sumisirit ang dugo para magdugtong siya. Tapos yung isa naman, dahil lumusot yung buto dito sa kabila, nakita ko, hinatak ko lang siya. Oo. Pero sa ivermectin, hindi ko naramdaman.
Basketball ba yung laro mo o yung klaseng laro mo?
Hindi kasi ang laro ko kasi tuwing Monday talaga naglalaro kami ng basketball para exercise.
Yung mga kasama mo sa basketball court, baka mga tulisan yung mga kasama mo siguro.
Dinoble team kasi ako eh. Yung isa sinundot yung bulay, yung isa napatid ako kasi simula sa kabilang ring. Kapag nahawakan ko na kasi ang bola, simula sa kabilang ring.
Kaibigan mo ba yan?
Sa kabilang ring.
Kaibigan mo ba yan? Bakit mukhang hindi kaibigan mo yan? Mga kasama mo dyan.
Inapatid ako. Siyempre, sa laki ko siguro, hindi ko na-control. Gumulong yun ako. Naitukod ko yung kamay ko. Siyempre, pag tatama yung mukha ko, kamay ko na ang naitukod ko. Hindi. Siyempre, mabilis ang nung pag-irit ng dugo, ivermectin ang ginagawa.
Pakimusta nga, Fred, ano yung injury mo? Turo mo sa daliri mo, ano nangyari?
Pakita mo.
Pakimusta mo, saan yung nabali, saan yung nasugat?
Yan, dalawa.
Yan, so may sinuture yan, yung dalawang area na yan,
Ito, ang ginawa ko kasi lumusot yan dito, yung buto, dito lumubo. Kaya hinatak ko lang yan. Noong time kasi, sa training namin noon, noong kabataan ko, sa loob ng 30 seconds to 3 minutes, manhid ka niyan. Malakas ang pakiramdam. Kaya hinatak ko na ito na kailangan magdugtong. Tapos tiningnan ko talaga. Ito dahil bumaliktad ito dito. Bumaliktad ito. Yan kasi
yan, tinahi yan,
Bumaliktad
yan. Ang ginawa ko, kasi nalaylay
open wound siya. Bumitaw yan, tapos yung tendons dito naputol, kaya nakaganyan, skin na lang nag-hold sa kanya.
Yes. Kaya ang ginawa ko
dito. Yung skin dito lang ang nag-hold.
Yes. Kaya ang ginawa ko, pinabuhusan ko lang siya ng dextrose.
Saline.
Oo, para idinugtong ko. Kasi yung dugo, nagpa-fountain, idinugtong ko. Noong nadugtong na, hinawakan ko lang kasi nahuhulog eh.
Fred, yung mga doktor malulugi sa'yo. Wala na silang customer. Wala na silang customer. Puro ganun ang style mo. Kung lahat ng tao, ganun. Wala na customer yung mga doktor.
First aid po yan, pero he went to the doctor to have it sutured, pati yung tendons ni repair eh. No?
Oo,
Opo.
Inayos na nila. Kasi pero doon ko nakikita yung ivermectin na pagka-effective kasi nang ininom ko, hindi na siya pumirot ng magdamag. Normally sa sakit nun, magkikirot yun eh kasi namamaga talaga siya dahil lumusot nga dito eh. Malat na lang yung dito eh.
Here's what, Manolo, I want to tell you, during the height of the pandemic, when I was having my Zoom, lots of people were coming. There was a time we exceeded the Zoom capacity of 1,000. And there were times like that. And we were discussing not about COVID. Many people were sharing to us so many things, the way they use ivermectin in just about in anything, no? So, Filipinos are funny. Nung nakilala ivermectin, they were using it just for about any problem.
Anything.
And they were telling us, Dok, nakatulong sa akin kayo dito. One thing, I was not believing eh. Sabi sa akin, Dok, alam nyo ba, may toothache ako, may butas ngipin ko, may dental caries ako, sakit. I took ivermectin na wala ang pain. Sabi ko, no, I don't believe it. No, Dok, kasi it never happened one time. Second time it happened, I did the same thing, nawala na naman. And then third time ngayon sinasabi ni Fred, can you imagine? So I was thinking baka may analgesic siya, may analgesic effect din siya, no?
Yes, Doc. That's true.
Like anti-inflammatory, wala siya sa classification as anti-inflammatory, pero yung prostate na tinatalakay natin, I don't want to go far from the topic, no? The prostate, ang statistics diyan, sa medicine we call it the rule of 60. 60% of all males at the age of 60 will have prostatic hypertrophy. They consider it normal, pero of course, if you have the prostatic hypertrophy, it's not easy to have that, no? It's really a problem. And I believe the nature of the problem has something to do with inflammation. Nag-i-inflame siya.
Yes.
Kaya nga namamaga yung prostate eh. And if you look into the property of ivermectin, it inhibits the nuclear factor kappa, which is the mother of all inflammatory mediators, itong nuclear factor kappa B. That itself, yan ang ini-inhibit ng ivermectin. Kaya, I think that's the mechanics why it's also working against prostatic hypertrophy.
Doc, there was something that I got from a doctor in the US yesterday. I wanted to discuss this with you. Just give me 1 second. I will read you the note because it's really interesting. Mm-hmm. 1 second, please. You bear with me until I find it.
Ay, Doc, may nakikiusap pala sa akin, si Sir GB, kung pwede daw na mayroon daw siyang emergency na patient, kung okay lang na papasukin natin at may i-consult sa'yo. Okay lang ba, Doc?
Kayo po ang may radio program. Kayo po ang
yes, okay. Emergency.
Okay, papasukin natin, Sir F. Makisuyo kung papasukin natin si POB, Tabagnot. Sir F, please. Nasa backstage, ayan. Okay.
Yeah, hello. Do you hear me?
Yes, baby, we can hear you.
Yes, hi. So thank you again, everyone. So I checked and I asked one of the staff of Dr. Landrita if I could consult him, and also every one of you, because you all seem very familiar with how people can recover. So my dad, it's also partly connected to Parkinson's, but he was recently confined, but we did a DAMA decision against medical advice, because he was confined for like 24 days, and it was for septic shock from UTI, and then later on bacterial infection from pneumonia, hospital acquired, and another bacterial infection from the IV. So later on, we just took him out of the hospital. And on day 1 of ICU, they gave him midazolam. After I just found out, they never asked us for permission. They gave him midazolam. And then when I found out, I told him not to give it again. And that was day one of his ICU, where he was supposedly in lack of oxygen. So other than that, as far as I know, I don't know whatever sedatives did they give him. But when we got him out of the hospital, this is how we treated him. He also has Parkinson's and prostate. So we gave him ivermectin every single day. We're giving him chlorine dioxide. We're giving him malunggay extract and also oregano extract. But I guess my question is, what else can any of you suggest, especially Dr. Landrito, can suggest for my father to maybe, because right now he can move, but he can't even stand or sit up on his own. But his blood lab results are good, but then he's still on NGT. So I don't know. I think we're using a lot of nice things. His bed sores have healed, but right now, until now, he can't sit on his own. He can't stand on his own, but he can move everything. It's just that he can't do it on his own. And it's been a month and a half since we've taken him out against medical advice because we
Okay,
felt he might just die.
let me know a few things. How old is your dad?
He's 73.
73. And you were telling he had pneumonia and then
He,
septicemia.
he first had septic shock from UTI. After that,
Mhm.
he got hospital-acquired pneumonia. And after that, he got another bacterial infection from IV.
So how long was he in the hospital for those problems?
24 days. But then again, I guess it's also key to know that they gave him on day one midazolam, and they might have given him more sedatives that I wouldn't have known. Because nadulas lang sila sa midazolam eh. So I asked them to stop it right away.
Yeah, if they're dealing with septicemia and septic shock and pneumonia and all that, no? Infection ng problema ng pasyente eh. Na-controlled na ba yun before you brought him out against
Yeah.
med?
The infection was gone already, but then he was just being prolonged, and there was no infection na. So we
Okay, so
just
it's
took him out.
okay. So what was the problem why he was why he was not being discharged and you have to bring him out against medical advice? Ano pang
Yeah,
problem niya na they were handling?
first
They were
he had very huge bed sores na in his buttocks, and they weren't giving the proper care, and he would also have a lot of other sores in his body. So we saw that they weren't even attending to that. They would make mistakes on his NGT. Blood would come out from his NGT because they would put it in incorrectly, and then the nurse would have to take it out, and then because it was incorrectly put in. When they took it out, a lot of blood came in, so they had to take another nurse to put it in. So it's all those things. But I guess right now his blood lab is good. We've given him ivermectin once a day, every single day since we took him out, and all the other things I mentioned. But I'm just wondering if there's something that
yeah.
might contribute further to
You
him
can do you
after.
can do a lot of things actually. Firstly, I suppose you are only giving one capsule of ivermectin or are you giving more?
Just one, just one.
Ayan,
Okay, so ang problem natin ngayon is with the bed sores, di ba? With the NGT,
It's his bed sores is
he's not on
fine na.
NGT anymore.
It's healed na yung bed sores. His NGT is still there. His bed sores, we've healed it na. But then right now, the main I guess my main question or concern is he still can't sit on his own and move like stand, but he can't even sit on his own, and he's still on NGT. He cannot sip more than once on a straw every day. He can
So
hardly
that,
sip.
that means the reason for that is he's weak, di ba?
Mm-mm.
Pero wala namang
Mm-mm.
ibang problem, hindi naman siya na stroke or
No
anything.
stroke. Yeah, we had his brain checked twice. No stroke. No diabetes. No hypertension. He's just prostate and Parkinson's.
And his food intake through NGT lang.
Yeah, NGT lang. We give him Nepro LP.
Mhm. Okay, so ang problem natin yung ano niya 'di ba? Yung nutrition niya kaya weak siya. Were you able to give the adequate amount of calories every day the way they give it in?
Based on the hospital advice, we give him 4 cans of Nepro LP. So I
And,
guess that's around 1,200 calories a day.
mm, Okay, you have to give him also virgin coconut oil. I think you can increase the ivermectin. Increase the ivermectin, gawin yung 2 capsules daily or even higher depending on his response. No? Kung wala pang side effects sa ganon, give him
Mm-mm.
3. No? Kung wala pang
Mm-mm.
side effects sa 2, give him 3. And if he sleeps, allow him to sleep as much as he needs kasi, maybe he requires more sleep para kasi the ivermectin will cause him to sleep. Hindi siya
Mm.
pampatulog, hindi siya
Mm-mm.
pampatulog pero aantukin siya para magbigay ng kasi magiging easy yung system niya, yung mga inflammatory mediators ini-inhibit ng ivermectin. Kaya parang kung stress na stress yung systems niya nare-reduce yung kaya na sumasarap ang tulog ng pasyente. Kung
Yeah,
masarap ang
you're
tulog
right.
ng pasyente, nag-healing siya, and
Mm-mm.
then sooner, he will be okay. Pero you have to give him the right nutrition, exposure rin sa sun, bigyan nyo ng high-dose vitamin C. If you
Mm-mm.
can give intravenous vitamin C, better. Kung hindi naman, just increase the sodium ascorbate intake. Sama nyo dun sa NGT feeding ninyo. Say, yung contents ng 4 capsules that
4
twice a
capsules?
day. 4 capsules of sodium ascorbate that makes 2,000 milligram. Do that twice a day. Or you can
2,000
maybe
milligrams twice a day.
give that will make about 4,000 milligrams a day.
Mm-mm.
So 8
4,000.
capsules, no? 4 capsules in the morning, 4 capsules sa gabi. Binibigyan nyo rin ba
Mm-mm.
ng multivitamins yan?
Well, he gets malunggay extract. Yung tea, yung from the leaves na. We get the juice, the
Yeah,
soup
you can do
from
that,
that.
but you give also a supplement. No? Lagyan nyo ng
Which supplement?
multivitamins. Maybe
Yung,
just Centrum Advanced, durugin nyo sa
kasi may multivitamins na po yung
meron na.
yung Snepro LP niya.
Mhm. Anyway, you have to increase the vitamin C then.
Mm-mm. Okay.
And also still give Centrum Advanced. Kahit mataas, kahit
Centrum
may
Advanced.
vitamin C.
Mm-mm.
Actually, ang nandun lang naman is the RDI eh. No? Yun yung tinatawag nilang recommended daily intake or recommended daily allowance. But we call it the ridiculous daily allowance. It's too low. So you have to give more
Mm-mm.
ng vitamins and minerals. So you add the
How
Centrum.
many Centrum tablets a
Just
day?
one. Just one. Yung vitamins yung gusto kong i-increase nyo ng
Yeah,
mataas.
yung vitamin C. And then yung VCO po, gano'ng kadami? Like
PCO,
1 teaspoon?
two tablespoonful at night.
2
Sa morning
tablespoons
naman, 1
full.
tablespoonful.
Okay. 1
And
and
then
2.
increase yung ivermectin, 1 capsule in the morning, 1 capsule sa evening.
Yeah.
Pero he can verbalize, nakakausap niyo siya.
Yeah. Yeah, he can speak naman. Pero you're right, he's always sleepy. Kahit ako po, I take ivermectin once a week and the effect is making me sleepy.
This time we're giving him daily, di ba? And 2 capsules daily.
Yeah, it's daily. Pero once a day, daily. It's
So
your
how long has
ivermectin nga. We order it from someone who gets it from you.
how long has he been taking it daily? Ivermectin?
Since June 20, I think, second week June.
Tagal na.
Okay. So, di naman naapektuhan ng niya eh, di ba? Kasi
No, we had his labs check. Okay yung creatinine niya, everything. It's all normal.
Had it been last year, kung na tayo, takot na sila, sabihin lang masama sa kidney tsaka sa liver.
Yeah.
So, ganyan, nonsense na yung ganun ngayon.
Yeah, I had his blood check. There's no effect. Like what Manolo said.
Excuse me, Doc. Can I add something?
Gil, yeah, please do. Gil.
Okay. May mga cases ako ng ganyan na bedridden, hindi na may taas yung butt niya. Naka na siya naka what you call this diaper. Fourth stage prostate cancer So very weak. 73 years old din. Pero ang una kong binigay na dosage sa kanya is 3 capsules one capsule 3 times a day.
Mm-mm.
In fact, on the second day, naitataas na yung puwet niya pag pinapalitan ng kwan, ng diaper. And then on the third and fourth day, nakakaupo na siya mag-isa. So, I believe masyado hong mababa yung one capsule.
Yeah.
Now, what we do actually is we give it one time. But because of my several experience na yung iba nag-hallucinate, so I decided that i-staggered na lang pag-take. Okay? So, yung mga next kong mga cases, if I say three capsules a day, ginagawa kong one capsule 3 times a day. And by the way, ano hong weight ng father nyo?
60 kilograms.
O 60 kilograms. So, kayang-kaya yan. So, that is 130 to 135 pounds. Okay. So, kung ako yung isa-suggest ko, I would go for, kasi nagsimula ka na naman ng matagal na yun since June pa.
Yeah.
Okay, so kung simulan mo sa 3 capsules 3 times a day, baka mas mabilis ang improvement.
Wait, Jill, are you saying 3 capsules 3 times a day or 1 capsule 3 times a day?
1 capsule 3 times a day.
Yeah, that's correct.
Yeah,
1
he's
capsule 3
overnight.
times a day.
Sir,
Yeah.
Jen, mas maganda siguro tanggalin na siya mismo sa capsule. Ilagay na lang.
Hindi. Sige, darating tayo doon, naka-NGT pa kasi.
Oo nga.
So ganitong
tinatanggal na nila yan. Minimix na sa NGT.
Ang ginagawa ko kasi, I don't know if this will help. Pero meron mga cases kasi ako naka-NGT na mga problema na pinapahalo ko pa rin sa kutsara, kutsara o teaspoon o tablespoon na BCO, tinatanggal yung ivermectin. And then pinapaano ko sa kanya yun, drop, dahan-dahan sa bibig. Marami akong magagandang results kapag tinatanggal ko sa capsule kasi mas magandang na-absorb siya dyan sa bandang bibig kasi kung if you will look at yung NGT stressful yan, pwede ka pa rin siyang ma-infect sa throat. So kung mas maganda kung kaya niyong iano siya na mapadaan niya, manuwayan niya sa throat niya yung BCO with ivermectin. Very successful ko sa marami kong cases na minimix yan rather than tinitake siya at least. Kasi nga, pag diniretso mo sa NGT without the mixture ng BCO, hindi, ang absorption niya because of the presence ng BCO is very important. So, minimix talaga sa BCO ang aking protocol dyan. So, magandang absorption yan sa katawan mo kahit sa NGT may pasok or you can use a dropper, dahan-dahan na malunok niya. So whichever is convenient for you, pero the method there is to mix really sa BCO dapat ang ivermectin. So may improve mo talaga may enhance mo yung effect ng ivermectin. So,
Maybe, can I ask, what's the reason why he's still kept on NGT? But hindi pa siya,
yun na nga.
can we not take him out from the NGT? Anong reason?
Yeah, we tried, pero kasi he can only sip once eh. So he himself, we tried to feed him with a spoon, just put water in a spoon. Nasasamid po siya eh. So we couldn't.
Nangyari yun? Anong reason? Hindi naman
We
siya
also
stroke.
don't. Yeah, that's also my question. I also don't know. I don't know kung nasugat ba siya sa hospital. Ewan ko anong ginawa nila sa kanya. Kaya,
Kasi he cannot be like that for the rest of his
Forever.
life.
yeah.
It's very irritating sa nose, or wherever that tube will go hanggang sa stomach. It's not good to keep that for a very long time, no? Kung may babag siya, hindi naman siya stroke, wala namang problema sa swallowing. Why don't we, kasi baka malimutan na rin niya yung swallowing eh.
So, paano po yun? Kasi nasasamid siya, meaning he spits it out. We've tried to do it by spoon and by straw. Sa straw later, he's only capable at times, not even every day, to just sip once, literally once.
Wait,
After that, he blows
you're
it back.
telling na nasasamid siya because the NGT is still inserted there, or you remove the NGT and you try
No,
to do
meaning when we, aside from straw, sabi ko, sige, he blows it back out from the straw. He's not able to sip continuously, literally just once. If it does happen, daily or once a day. We tried by spoon, teaspoon with water. Pinaano namin, binigay. Nasamid siya, hindi niya kaya. And he himself, he doesn't, he said hindi daw niya kaya.
Now, Phoebe, what I'm asking is, kailan nyo binibigyan ng straw? Nandun pa rin yung NGT niya, naka-insert? Or remove it,
Yeah,
you
yeah.
remove it, then you feed him?
While the NGT is still there, we try with either the spoon or the straw.
Hindi, talagang
Of course, ganyan masasamit talaga. May NGT
Masasamit
naka-insert eh.
Mm,
You have to take off
okay.
that NGT. That's why you have to recall back. What's the indication why they gave him NGT? Was it because he was unconscious during the time he has the septic shock and septicemia? Kaya
He
awake naman
just
siya.
had
Huh?
he just had lack of oxygen. I also don't know why they put NGT. They're just saying na he lacked oxygen and he had an infection, so better na NGT. That's just what they did.
But
They
the
didn't say.
infection, the septic shock, the septicemia was resolved already. The
Yeah, it's
pneumonia
resolved.
was resolved already. So there's no indication anymore to keep him on an NGT. So you can determine if masasamit siya or pag inalis niyo yung NGT, sorry, nalis niyo yung NGT and then you try to feed him, then we will know kung intact pa yung swallowing reflex niya.
I think okay. So how long will we remove the NGT?
How often are you changing the NGT?
Every 2 weeks.
So from the time during the time na naka-schedule siya, you have a nurse coming over your house and then
Yes, we have a nurse who
okay.
comes and
Nandiyan yung
removes it.
nurse, tatanggal yung NGT, try to feed him. Start niyo muna ng soft like yogurt or soft lang muna. Pag maganda naman ang tolerance niya sa food, sa ano, then bakit niyo palalagyan ng NGT?
Hindi na namin balikan. Yung important, we try to feed him while the NGT is not there.
No,
Yes.
Yeah, you have to remove the NGT and try to feed him. Soft
Yeah.
muna tayo ha, like yogurt or...
Hindi po muna water. Hindi water yung
Yeah,
start.
of course, painumin nyo. Kung magandang inom niya, then feed him. Then we will see.
Sige, we'll try.
Which is why going back to my suggestion, with that sabi kong dropper or sa bibig niya, kung pwede niyang lawayan, yung sinasabi kong malunok niyan dahan-dahan or dropper, dahil masasamid pa siya dahil doon sa NGT. Pagka may target there is actually yung yung pharyngeal niya na gumaling din muna. So pag gumaling yan at by the time natatanggalin na siya, baka mas healthy na rin yung throat niya, then that could give him a better chance ng na talagang kaya na niyang mag-swallow, basta dahan-dahan lang ang approach. Huwag niyo lang talagang biglain lang kasi ilang buwan na yan sa kwento ninyo naka-NGT siya, so hindi talaga kadali bumalik yung kanyang senses na mag-swallow. And he's 73 years old.
Yeah.
So pagkatanggal ho ng NGT, huwag niyong biglang painumin agad ng tubig naman. Medyo i-relax.
Oo, yung
Drop.
Dahan-dahan lang. Huwag naman bigla agad na painumin ng tubig.
Kaya maganda siguro yung suggestion na lang kung yung ivermectin tanggalin, ilagay na lang siguro sa dila dahan-dahan para laway lang niya yung manunlok niya. Kasi kaya niya yun eh. Mas
Kahit po may NGT, ilagay namin yung sublingual.
Opo. Pero lang siya, powder lang ha.
Yeah, yung powder. We'll remove the powder, sublingual under his tongue.
Para kung sakaling mayroon siyang dito sa lalamunan, kasi yung immune system natin nandito rin para aakyat siya, kumbaga para magkakaroon lang siya.
Okay.
No, I think Jill will agree with me. Maganda na sa VCO.
VCO.
Yes.
The VCO will also be kasi
Lubricant.
may marahil may lesion sa larynx niya.
Yes.
So at least
BCO talaga.
VCO will help kasi VCO can handle some bacteria, certain fungi and the other.
So what we'll do first is we put 1 teaspoon, one tablespoon under his tongue, and then we put the powder under his tongue.
No.
You mix the
mix the tablespoon. Yung
you have a tablespoon here. You have a tablespoon full here. You just fill it half with VCO, then put the powder there, and then from there you can mix it and dissolve it from there, and then you give the
under the tongue.
Under the tongue.
Okay.
Or just in the mouth. Then hindi naman yan lulunok and it will be absorbed from there.
Okay.
You can do it not necessarily diretso ng kutsara, but you can do it by dropper. May maliliit na dropper, no?
Yeah, use a
So,
dropper.
ganun lang, dahan-dahan lang. Ang key muna dyan is gamutin muna natin yung throat niya.
Sige
Sigurado meron yan swollen yan or meron yan. So,
And also,
pagka
Phoebe,
naka-recover siya,
I will suggest also for him to do oil pulling
Oil pulling.
oil pulling therapy. So what you do is you get 2 tablespoonful of VCO, just put it under the mouth, instruct him na swish lang niya, lalaro-laruin lang niya sa mouth niya, no? And then
Then
he
spit it
may
out.
make some salivation, no? Then he has to spit it out kung puno na ng saliva, no? Then
Yeah.
he has to take again until he completes 30 minutes. It's called oil pulling therapy because the oil is just in the mouth, but it cleanses the whole throat, no? Tung larynx and pharynx, and even the nasal cavity. The oil is pulling every toxins there, every bacterial or
So he has
fungi.
to keep it in his mouth for 30 minutes?
Yeah.
hindi niya kaya. Mga 5
Hindi
minutes
niya
na siguro.
kaya.
10
Yeah, I
hindi
think
kaya.
malalang.
Sandali lang siguro. From time to time na lang.
Bakit po? Kala ko awake naman siya, di ba?
Yeah, sometimes, but lately tulog po siya ng tulog.
Oh, hindi, during waking periods, of course, no. You keep it inside the mouth and just play with it, no. Laro-laruin lang niya. Of course, he will salivate, and pag napuno na ng saliva yung mouth niya with the VCO, has to spit it out, then take take a new 2 tablespoonful of VCO hanggang makomplete yung 30 minutes. Or
Okay.
20, as a compromise, 20 to 30 minutes. That's how
20.
pulling therapy is
Paano
done.
po accidentally na ano niya? I mean, hindi niya na-spit out lahat. Okay lang, no? Kasi it's
Okay
VCO
naman.
naman.
Okay lang po. Okay.
Okay naman.
Pwedeng magtanong, yung kama ba niya, nare-raise niyo yung likod niya? Kasi pagka ganyan, dapat itataas niya na parang sitting position.
Yeah,
Or
nasa
unan.
medical bed. Medical
Okay,
bed po
good.
yung gamit.
That's good.
Meron yan.
So,
Pwede mo-
tinataas namin siya pag
Okay.
eating.
Yeah.
Yeah.
Okay.
So,
Ano-
simula ho tayo sa 1 capsule 3 times a day.
Yes. I will follow that 1 capsule. Imimix ko po sa VCO. Yung half a
Yes.
tablespoon VCO and half of adenosine powder. And then the oil pulling once a day. And Centrum Advance and total of 8 capsules of vitamin C.
Ano kaya kung pag yung inaano niya na BCO, kung lalagyan natin ng ivermectin, magbigay na lang tayo sa kanya ng ivermectin na free para hindi siya manghinayang.
No, iba yung ivermectin na inumin niya, iba yung oil pulling.
Yung isasama doon sa isasama niya doon sa pag
Oil pulling.
Oil pulling niya. Yung oil pulling niya. Lalagyan din.
Hindi, BCO lang yun, dudura na yun eh.
Lang. Okay.
Saka yung kung i-medicate na natin siya, tsaka kasi
okay.
magkukonfusion eh. Dudura niya eh, hindi natin alam kung ilan ang
ilabas.
consume niya yung ivermectin.
Na-consume mo tsaka hindi.
So maganda yung pag-consume mo, alam mo kung ilan yung binigay mo.
Kung ilan ang binibigay.
Dudura niya.
Okay na po, ma'am?
Yes. Thank you. I'm very grateful for all your help, for you, Dr. Landrito, for you, Hill, and Mr. Fernand.
Fernando.
Yeah.
Apa.
Fernand. Yes. Thank you.
Kasi Sir
And also
Manuel
to-
kasama din po namin. Sige.
Yeah, and
Ma'am,
also
Phoebe, I hope you're...
I'll let you
Phoebe.
know of the PSA.
Phoebe.
Yes.
I hope your father gets well. Okay.
Yeah.
I hope your father gets well. And if he doesn't get well, get some lactoferrin. That's a milk protein. Okay, that's gonna make him really strong. Just do what they've told you already. But if it doesn't work, buy him some lactoferrin and give him.
Is that
800
over the count? Is that over the
Yes.
counter?
Yes, over the counter.
When I
It's
say
a
that
milk-
Mercury at the pharmacy,
Yeah,
they'll understand
yeah.
what it is.
Yes, you just ask
Yep.
them. It's lactoferrin. Just do what they're saying, But in case he doesn't improve, give him some lactoferrin. You'll see an improvement. It's a milk protein, and it brings the iron up. And what it does is it fixes up all of the bacteria. A lot of the bacteria that we have in our gut requires iron, and sometimes we don't have enough iron in our body, and therefore our gut is not strong. So just keep that in mind. Lactoferrin, but do everything they've said because that everything they've said makes total sense. So just keep that in the back of your head. If it doesn't work, give him some lactoferrin, 800
No,
milligrams a day.
I will say don't wait for the things that we said will fail before you give the lactoferrin. You give the lactoferrin together with everything that we said.
Yeah, because the lactoferrin we're doing with the test that we're doing on the lactoferrin, we are amazed.
Yeah.
So lactoferrin 800 milligrams.
800. Wait, what's a dose per day?
800, your father, which he's small, so 800 milligrams a day is perfect. You give it to him. You give it to him for 10 or 20 days. It's an iron. What it is. You can read up on it. It's a milk protein, and it's given to people with low iron, and it's really good for people whose gut is defective. When your immune system is weak, you take this and it helps out, and it's also very beneficial for many cancers.
Okay. Yeah, I'll do that.
Phoebe, I think it's available in health shops. I don't think kung available sa mga pharmacy. Meron ba sa pharmacy niya?
Doc,
healthy options.
Doc Hanan, there's a preparation for acne in Manila. They sell it in Mercury. I think it's called Lactacid. Ask for it. Just ask for lactoferrin for acne, and it has other things in it, but they sell them in pills 100 milligrams. So he would need to take 8 of those a day.
So we can use that now, even if it's for acne, no?
Yes, it's safe. We've used it.
Okay.
Okay. So again, thank you, everyone. Thanks, Doc. Landrito. Thank you.
Ma'am Phoebe. Okay, sige.
Thank you again.
Doc, batiin muna natin yung nakikinig natin dyan sa Butuan City. Si Beria Flores, si Merced Miano, si Estela Arinque, si Tonyo Adlaon, si String Adlaon, si Rodi Paldo, si Rene Paldo, at saka si Abner Paldo, at saka si Emily Paldo, at saka si Donna Paldo, dyan sa Butuan City. Yan. Kumusta po kayo dyan sa Butuan? Ingat po kayo. Sana inumin nyo ng ivermectin ng maayos at para sa kalusugan natin. At saka mayroon din namang N-acetylcysteine para sa ubo. Kasi nakakatulong din yan. At saka sa mga kagat ng lamok, kasi ang ivermectin ay gamot din sa victim. Okay, salamat. Yes.
Doc, ano sa tingin mong unahin ko, Doc? Yung stage 4 breast cancer or yung diabetic?
Ano yan? Testimony or what?
No. Papakita ko lang yung some picture and
let's wait for Manolo para makita din niya. Parang sumaglit siya.
Wala pa ba si Manolo? Okay.
Sige. Batiin na lang din natin dyan sa may Montalban. Sila si Junjun, si Glenn, at saka si Manuel Bungalos, at saka si Mike. Nakalimutan ko yung apelyido ni Mike Ayun. At si Edith Lopez nanonood din sa atin dyan sa may MRB. At saka si Anisi Talawag at si Pedroso. Okay?
Before, anong papakita nyo? Pictures ba?
Pictures muna. Dalawa lang itong...
Were you able to get the consent of the patient? Kasi we are on public, baka ayaw nilang makita sila.
Yeah. Kung gusto mo, unahin ko na lang yung diabetic. I have.
Ito ba yung diabetic yung vaccination stamp?
Yes. Willing siya mag-testimony.
The patient, we have the consent.
Yes, of course.
Okay.
Willing siya mag-testimonial, sabi niya, pero hintayin daw niyang magawa na yung kanyang prosthetic to show you from where he is and where he is now. So, nasukatan na siya. Anytime siguro, mga another week pa siguro, mapiprepare yung kanyang kwan. May picture naman ako dito dun sa stage 4. Hindi kita yung mukha. Dalawa lang. Yung stomach lang. Tiyan lang. May shingles to, tsaka yung kwan. Just to show yung pagka yung metastasis niya.
Before and after pictures?
Hindi. Merong ongoing pa ito, Doc, ha? Ongoing pa to.
Okay.
Pero in 2 weeks time lang, meron talagang discerning. Nawala yung amoy, Doc. Dati, sabi ng anak niya, pagka bibisita siya, hindi siya makakasakay sa public kasi dumidikit sa damit yung amoy. So, kailangan papasundo siya ng private na motor ba, I don't know kung ano sasakyan nila, para umuwi dahil ang baho no talaga. So 2 weeks treatment na yun, Doc, nawala talaga yung amoy, tsaka nawala yung pus.
Yun ba yung
dibdib.
Sir
And-
Jel? Yan ba yung Sir Jel sa yung pinadalhan natin diyan sa Parañaque?
Yes.
Yan.
Yan, ito. So ongoing, may controversial pa nga tinigil ng anak.
Ayun nga, itinago dahil nga daw nagtulog ng tulog parang ayan nandiyan na si Sir Manuel.
Okay.
Pwede mo nang kay Sir
Yeah.
Ed.
Manolo, we're waiting for you because they want to show you the pictures of the patients. The one with an infected diabetic who had infected amputation stump that went on for 6 months.
Stage 4 muna, Doc, o yung diabetic?
Diabetic stump na.
Diabetic.
So
Diabetic muna.
I could not imagine that even with bacterial infections, ivermectin will work. Walang document na ganyan.
Yeah.
The history was, correct me, Jill, if I'm wrong, it has
Okay.
been there for 5 or 6 months na the doctors were trying
5
to
months.
manage. 5 months.
5 months. Yes.
5 months.
5 months with all the kind of medication.
Yeah, can you give the history first before you show us the picture?
Ay, sure. Okay, ito muna.
Can I just interrupt?
Sure.
Okay.
This is something that's, I think it's going to make everybody happy. I just got a message from Dr. Lowry, and she's asking if we already have a study protocol for the study that we're making. So I hope we're able to get through Doc Lowry and we can make this community study spread. No? So we've got some good news.
That's Dr. Tess Lowry.
Yes.
Lowry, yeah. Oh, good.
Go ahead, Doc.
So, okay.
Wow.
Okay, nakita niyo yung panya. Anyway, babasahin ko muna, Doc, ha. This is how it started.
Hindi ito yung amputation stump. Ito sa hill ito di ba?
Sa kabila pa yan. Yung isa pa yan. Pera pa yan. Mamaya tayo darating kamo dyan Kaya hindi ko na muna anuhin. So, ito yung kanyang, Good morning,
history.
Jill. I am so-and-so, and a common friend, told me about your ongoing study research on ivermectin. She told me you are spearheading the study, and that you are at the lead authority on ivermectin therapy, treatment, and dosages, and that it will be best to correspond with you directly regarding my current condition. My right leg was amputated at the level of the thigh last October 2021. Unfortunately, the wound was infected and healing is very slow, even after both oral intravenous antibiotic therapy. She mentioned your project and suggested that I connect with you as may be a good candidate for your ongoing research. This is dated February 23. Okay? And then, ito na. By the time, ito na, February 25. Good afternoon, Sir Jill. Here's my narrative on my antibiotic therapies. On the second day of October 2021, I was rushed to the Olivares General Hospital due to a severely infected right foot. 2 days later, the infected foot was immediately amputated to prevent further spread of the infection. Upon further examination, it was determined that the infection has reached higher up my leg and another surgery was scheduled. The rest of my right leg up to the level of the thigh was scheduled for amputation. On the 14th October of 2021, another operation was done to amputate the remaining leg up to the thigh. On the 17th of October 2021, I was discharged from the hospital. Detailed instructions on post-operative care and cleaning of the surgery wounds, schedule and dosages of medications were given. Part of the treatment regimen was an oral antibiotic, ceprofloxacin 500 milligrams for next 2 weeks. I was advised to return a week after discharge for follow-up examination. On the 25th of October 21, I returned to the hospital for follow-up. The orthopedic surgeon who performed my operation noticed some pus from certain portions of the stitches and immediately collected samples for laboratory examination. We were referred to Dr. Blah 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 of the Internal Medicine Infectious Diseases Department of the hospital. A week after, the laboratory results of the swab pus samples revealed an infection that was not susceptible to current antibiotics prescribed. The infectious agent identified was Klebsiella oxytoca. Dr. So-and-so prescribed ertapenem R for IV infusion for 10 days. 10 days after IV infusion of ertapenem, it was found that the infection was not completely controlled. Dr. Blanc prescribed a stronger oral antibiotic regimen to control the infection. Dr. Blanc prescribed linezolid 600 milligram along with moxifloxacin 400 milligram to be taken 2 times a day for 2 weeks. After much delay in procuring, blah, 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 we are able to purchase the antibiotics. Oral antibiotic treatment with linezolid 600 milligram along with moxifloxacin 400 milligram was completed on January 4. After 2 weeks of treatment, improvement in the wound healing was observed. Dr. Blanc advised to stop all antibiotic treatment and instructed us to just clean, disinfect, and change wound dressing daily. To date, wound is still not completely healed and some pus continue to leak out. So this is on January 4, they stopped already the medication, no? Since October 16 till January 4 ang medication yan with all types of ang sabi pa niya itong antibiotic, doc, pag inin niya within 30 days suka, tae, at saka collapse daw siya talaga kasi napakatapang na nitong mga antibiotic na ito. So by January 4, meron pa ring pus, etc. Tinigil na ng doktor yung antibiotic. So clean up. So that was January 4. Now itong communication naman was February 23 and then 25. And our study actually started on March 1. Okay? Hindi lang. Ngayon, sinabihan ko lang si F na i-post yung video.
Okay.
Yung video, F, paki-post.
Ayan.
Isa pa, before. Yan, okay, that's it. That's before the medication.
So a lot of pus is coming out, no?
Yeah, you can see that. Yan, kita mo, sumisirit. Manolo, can you see that?
Ganong kadami yung pus na nakukuha every time?
Actually, Doc, ang dami ho niyan kasi sabi niya, bago pa niyan, pigaan yan, meron na siyang balot niyan, kiksapan niya. Oo, basang-basa na po yun. Basang-basa na yun, Doc. Siguro kung isang tasa lang o isang baso, ganun ang kanyang daily, ha? That's daily. So, yan.
So, sa area na yan, di sa stump, doon sa dulo, meron din?
Wala, yan lang butas na yan, yung dalawang butas sa stump pula.
Okay.
Yan na lang yung exit wound niya. Yan yung exit wound niya, yung dalawang yan.
So it's been going on for how long na ganyan?
Since mga almost 5 months. Kasi February 2023 na niya pinakita yan. Isa pa, another one. Yan, no? Yan, sumisirit.
Wala na silang binigay na antibiotic when you started ivermectin?
Yeah, wala. January 4, tinigil.
Antibiotic? January?
January 4, ang last na binigyan siya antibiotic.
You started giving ivermectin March na?
March 1, yes.
Okay, tell us what happened when you gave ivermectin, how many ivermectin, and
okay.
Anong result?
Always ang protocol ko talaga, minimix ko ng virgin coconut oil, no? The 6 capsule, 1 time.
So oral mo yan, pinapa-oral mo?
Yes, oral. 1 time ang intake niya dyan. So 6 capsules. On the 3rd day, sabi niya, na-reduce na 60% yung pus. And the color also has improved from green to light yellow on the 3rd day. Okay? And then on the 7th day, nag-monitor ulit ako, natakot na siya. Sabi niya, Sir Jill, bakit? Nagsasara na yung sugat. Sabi niya, natatakot siya kasi saan lalabas yung mga nana na, because he was already used to for almost 5 months yan na talagang hindi nawawala yung pus niya sa legs niya. Ito, on the 17, nagsasarado na. So anyway, sabi ko, theoretically, sabi ko sa kanya, dapat pag magaling na yan, magsara pati sa loob. But I am not so sure, I'm to be honest, kasi ang sugat niya nasa kaloob-looban from the thigh. Tinanggal yung buto mo. So I cannot really exactly give him the assurance, but theoretically, sabi ko, dapat magaling na yan. So there is much squabbling even sa anak niya kasi nga this time nagtatakot na sila sa father nila kasi tulog ng tulog. Remember, tulog ng tulog ito. So, but he decided sa niya, I cannot jeopardize my medication. So sinunod niya ako. So on the 10th day, exactly on the 10th day, nagsarado yan. Yan yung nakikita nyo. Up until now, wala nang hindi na nagkasugat yan.
Amazing. Yeah.
Nag-therapy na yan kasi nag-therapy na siya. And imagine
Pero,
by the
what
time
was, what was his the
Ano?
status of his sugar during the time na controlled ba ang sugar niya or mataas lagi ang sugar niya?
Medyo nagte-take siya ng medication eh. Pero actually, Doc,
There was nothing
Actually-
new na dati niya tinitake hanggang sa nagbibigay ng everything, same medication ginagawa niya.
yes.
Nang change,
Yes.
hindi siya nag-insulin or anything, wala.
Meron siya ata. Meron siya sa kwan.
Pero walang change. Yan ang ginagawa
Walang
na niya
change.
before pa.
Walang
before
change. Of course, walang change.
Yun din ang
Yes.
okay, good.
Yes, walang change.
May I interrupt?
Okay, Manolo. Yes, Manolo.
You know, my only concern here is this poor guy. No? I was listening to your explanation of his letter. What started out with the foot, went up the leg, etc. Can you imagine, Jill, if you had reached him at the beginning?
Yeah.
And had given him ivermectin at the very beginning, maybe he wouldn't have. He would only have, just his foot amputated, and he still would have a leg. If you had gotten to him sooner.
Later, I will show you. Yung isa pang picture, yung kaliwa niya, di ba, nagsusugat. Napagaling din natin yun, ano? Okay, anyway. Sabi ko, careful lang, huwag ka kagad papasok ng therapy. Kasi hindi natin alam kung baka bumuka pa yung sugat mo kasi so it took him at least a month to allow it to muna, no? And then saka siya nag-undergo ng therapy. So that's March 10, then April nagte-therapy na siya, dandahan. Magaling yung physio niya. And then itong July, nag-casting na siya, and mga 2 to 3 weeks yata hinihintay na lang niya yung kanyang prosthetic leg. Alam niyo yung paa niya na ginamot natin never up until now. So nagulat nga yung mga nag-ano sa kanya na bumalik na yung lakas niya. Tandaan niyo, he's supposed to weigh 106.57 siya. Ang dati niyang weight is 160. Tama ba ako? Yan, 160 yung weight niya. Imagine, naging 68 pounds na lang siya nung nag-start kami ng medication niya.
So, payat na payat.
Payat na payat talaga. Halos daw yung skin niya nakadikit na sa buto niya eh. So,
and then now, pinagain this weight back?
Yes, ito. Actually, lumakas na nga daw siya. Dati nga, hindi niya maingat yung puwit niya. Ngayon, nakakapunta na siya dun sa parang stroller niya para tumayo. In fact, sabi niya ngayon sabi niya, I'm not even putting much strength on my hand just to get up. In fact, I just use my hand for the balance kasi isa yung paa niya. But either way, he can already lift himself. Kakausap ko lang siya lately.
Yeah, ayun. This time may prosthetic.
Hinihintay na lang, Doc. Hinihintay na lang niyang dumating na yung nag-casting na siya, kinas na kung size, etc. So, pagdating noon, he wants to present his testimony, yung nakalakad na siya. Para dramatic daw.
You know, this is something that is unimaginable, no? Ivermectin, known properties, antiviral, antiparasitic, immunomodulatory, and anti-cancer, but not antibacterial and purulent bacterial infection like Klebsiella and all that. Amazing.
Wait, Doc, pagdating sa stage 4, papakita ko rin sa iyo. Ano nagagawa natin?
Okay. With the stage for breast cancer?
Yes.
Okay.
I wish Jill, Dr. Alan, and Fred, no?
Yes.
I wish you can just make a short recap of these different cases so that we can just post them on the community because it's unheard of. It's very hard to believe. You see,
This is the way to approach it, ha? This is the way to approach. Kasi I was privileged to have discussed with the doctors who are very prominent doctors who knows how to do it. Have been writing on medical journals, no? Sabi niya, pag may ganito, first do a case presentation. We can document it, case presentation with all the pictures in the video, or of course pictures kung ipiprint yan, no? And then Jill, since you are the one who have been with the patient, who know all the details, just document it. Gawin mong case study. It's a case study.
Yes.
That can be published in the journal, okay?
Oh,
And then,
yes, yes.
you know all the message he's taking. You can, kung makukuha mo pati yung mga laboratory niya, kung anong sugar niya during that time and all that. Kung
Yes,
nakakuha
yes.
ka ng pati yung safety profile natin sa ivermectin, nakuha mo yung SGPT and creatinine.
Yeah.
So, may natin yun. Then, after that, we can ano. Then, I see, ang tanong ko ngayon, is he continuously taking ivermectin until now?
Okay, ganito yun, Doc. Ano? But I have to tell you also what happened. No?
Okay. Yeah.
On the 7th day,
Excuse me lang.
No,
Just have to
10th
take a
day.
call. I'll be right back. Sorry for a bit.
Okay,
I'll be
okay.
right back.
Okay. Yes, caller.
on the 7th day, Doc, medyo may hallucinations na siya. So, on the 10th day, nung magsara yan, nag-culminate, talagang matindi na yung hallucination niya, Doc. Which brings me to the conclusion, to the idea na pag magaling na yung tao, wala nang pupuntahan yung ivermectin. Kaya mas tumitindi na yung kanyang hallucination. But during the treatment days, with all those infections, with all those organisms in his body, preoccupied ubos yung ivermectin doon sa pagtitreat na paglalaban niya sa mga mikrobyo. Wala pa siyang hallucination doon. Pero nung pagaling na siya, talaga nag-hallucinate na siya. Kaya yun ang warning ko lang. Actually, winarning ko naman sila. Actually, bantayan. Bantayan kasi baka mahulog, etc. Yan ang parati kong tinatanong sa mga kliyente ko. Bumababa ba kayo na hagdan, etc. etc. Pag pumunta kayo na CR, baka doon kayo mabagok. So you should have some assistance. Basta may treatment akong ganyan, I always make this caution na i-assist talaga. And if you feel sleepy, just go sleep. Kaya nga, Doc, ang gusto ko talaga ditong pag-meeting natin ni Dr. Aisha, how was she able to take 8 capsules? Nang without any, nang hindi siya nahihilo.
Yeah, actually, the way I look at it, like in the case of COVID, pag severe ang COVID, we go high, walang side effect eh. We go high.
Yeah.
Naging meter natin, gauge yung pag may side effect natin, I called it the spillover.
Yeah.
Na nasaturate na ng ivermectin lahat ng spike protein ng COVID, ng SARS-CoV-2. Kaya may spillover na, may excess na, nagpupunta na central nervous system, may visual disturbance na. Pero during the time when they were just starting, wala eh, no? So I think the same thing is happening in cases of cancers. Pagka na-address na yung cancer, then there's no need for too much of this ivermectin. We can lower the dose kasi ang malalaman natin may mga side effect na.
Okay, dito sa case Doc, dito naman sa case ng isa.
May I just clarify, Dr. Alan? If I were to understand what you're trying to explain, let's look at it like in terms of a glass that's full. Okay, so you have now different ailments, bacterial problems, acne, cancer, COVID, whatever. And we start taking ivermectin. And while the threshold for all of those things is not yet full, you can still take ivermectin. No side effects whatsoever. Now, there comes a time where everything is covered. Everything, your cancer, your COVID, your parasites, because it's a medicine that cures everything, di ba? So, at that point, when you start taking more than your body needs, your body tells you, hey, you're taking too much. You're now overdosing. And the body tells you, I'm dizzy. This is, I think, what you're trying to explain. Is it more or less like that?
Exactly. That's what I tried to.
Okay. Thank you. So it's this is what I received from a doctor. She said, prostate enlargement and cancers increase production of TMPRSS2, to which ivermectin binds. So this is the explanation as to why, perhaps another reason as to why ivermectin is good for enlarged prostates and prostate cancer. That's the explanation. Prostate enlargement and cancers increase production of TMPRSS2, to which ivermectin binds.
Yeah, those are the
In,
pathways of cancer development. No? There are many, no? And that's why I used to say there are already a number, about 12 different kinds of organs that are cancer of which are improving or responding with ivermectin. No? But not all the cancer cell lines. A particular organ can have different types of cancer. Not all those cancers there can be addressed by ivermectin. It has certain pathways by which it works. So we have to, no, we cannot say okay yan sa breast cancer, okay yan sa colon cancer. Although there are studies, it works for certain ovarian cancer, for certain colon cancer, for certain different other cancers, even leukemia. There are cell types, no, cancer cell types, but it won't work for all. No, so it's a matter for us to for the whole science to go into that level in determining which cancer cell line it will work. But for us at our level at this time, we just have to show it works for us for certain cases that we are able to handle, but we cannot tell everyone it will work for everyone, no? For all kinds of breast
understood.
cancer, for example, for all,
Understood.
yeah, okay.
Understood, doctor. Thank you for
For them,
the.
we will try because we don't have that luxury of testing the what type of cancer cell lines we are dealing with, no?
Correct. Nor do we have the time, nor do we have the capacity,
Mhm.
nor do we have the money. Because many
Yeah.
of our patients, many of our
Volunteer.
cancer patients, pulubi, di ba? Pulubi.
Yeah.
So
Volunteer.
papatesting pa natin lahat. Hindi natin kaya patesting lahat, di ba?
Mhm.
So,
Yes, that's true.
But
I think we have to be pragmatic and we have to be practical, no?
Mhm.
I was just talking to somebody this morning. I'll bring it up now that Dr. Landrito's here. I was just talking to somebody this morning. He's 69 years old. His PSA was 40 something. 40 something.
Mhm.
And just recently, his PSA was at 22. Now, he was diagnosed with cancer just this year. And the Gleason's reading is 3 plus 3, 6. Okay. But he had the bone scan, and the bone scan revealed that he appears to have some kind of lesion in two ribs, meaning it's not yet
metastasize na.
clear, but it looks like it may have gone out. Now, my question is this: I was asking, no, in my mind, I said, if it's only a Gleason 3 plus 3, total 6. That means that the cancer is still inside the prostate, and the cancers and the cells inside the prostate are more or less normal. They're just starting. Kukunti lang
Mhm.
yung abnormal cancer cells, no? So that doesn't sound like it's compatible with getting already the cancer elsewhere. But we don't, of course, we don't know, no? So in this particular case, I was telling him how much ivermectin should we give him? And I said, well, to begin with, the minimum that we looked at, which is 0.3 to 0.4 to start. Pero ako, my feeling is baka we need to give him more already just in case lumalabas na siya, no? So these are the kind of questions that we have to be able to address, no? And of course, this fellow he's not exactly mayaman, no? So, and of course, he's concerned about all of the tests na kailangan, no? So this is why your experience is so important, no? Kung this thing of one capsule 3 times a day, for this time, this is so important, no? Because we do not have the luxury of time. Eh. We don't have the luxury of time. And this guy is 69 years old. Medyo mabigat yung kaso niya, no? And that's just one case, no? So we have many cases like that, and this is where we need the experience of everybody combined, no? As to
Yeah.
how to use the ivermectin.
If you can imagine during the COVID, no, last year, we were having lots of COVID patients. We have to give, kaya na-evolve yung concept ko na you have to give the high enough dose right away. maybe you're thinking you're giving high dose already, you're giving 5, but it may be not enough. Though it's high, it may be not high enough. So next day you
Dr.
have to give
Anand,
7, next day you give 9, and all that.
Dr. Anand, I don't know if you remember of this case of an 80-year-old man. Okay, 80-year-old man, and I will repeat the case because the case is for me beautiful. This 80-year-old man picked up COVID, and he was brought to the hospital only on the 9th day. The wife gave him ivermectin only on the 7th day, and she only gave him 2 pills. Okay, so on the 9th day, he was really sick. Oxygen saturation niya was already 85%. So she went to talk to Dr. Landrito. And Dr. Landrito said, bigyan natin ng ivermectin. 7 pills. At that time, it was still 7 pills. Maaga pa eh. It was still at the beginning of the thing.
German yan, German.
No. Hindi sa German.
Okay.
Filipino.
Filipina.
No? So she started asking help from everybody, no? So I was able to talk to her, and she told me that she had been able to get in touch with Dr. Landrito, and that Dr. Landrito said 7 pills. But he was not getting, there was no reaction, no? And the doctors insisted that this man had to be intubated, or if not, he was going to die. So, ang nangyari, she had no choice but to make payag. Pumayag siya, nagpa-intubate yung husband. Ang problema sa intubation, hindi natin pwedeng bigyan ng ivermectin kasi puslit ang bigay namin. Eh. So I told the lady, magluhod ka, sabi ko, magluhod ka dun sa mga doktor. You beg that they allow your husband to be given ivermectin on the gastric tube. And then what happened was, we ended up giving this man, with Dr. Landrito, pinakit yung dosing. And he was given, in the end, we were giving him 1.9 mg per kilogram per day through the gastric tube. After 16 days, he was extubated. Today, kausap pa lang 3 days ago yung missus. The guy is fantastic. He's living it up. Buhay siya because of the ivermectin.
Yeah.
We were giving, that was 1.9 milligram per kilogram per day for 16 days.
That's high, yeah.
That was 16 days. Malaki yun. At that time, at the beginning, that sounded like a very big dose, no? But based on what we're saying now, hindi siya malaki. So yeah. And this is a case of Dr. Landrito. I just happened to be there to help along the lady, to convince the doctors to beg. Mabuti pumayag yung mga doktor sa hospital, no? Na bigyan siya ng ivermectin through the gastric tube. Buhay. So we have to be really thankful for all of these opportunities.
Manolo, we have to look also for another case. We may run out of time.
Go ahead, please. Go ahead.
It's okay. You have another case, right? Yung breast cancer,
yes.
Stage 4. You have photos also.
Ako, Doc? F?
Yeah.
Pakitext nga si F.
We have only a few minutes.
Yeah.
Marami tayong gustong pag-usapan. We really need to adjust natin yung time natin. We have to extend. We really need to discuss so many things. Ito yung sinasabi mong stage 4 breast cancer?
Yeah. Okay, stage 4 breast cancer.
Lesion,
yung kan baka i-post na ni F. Hindi na mastectomy yung babae ito.
Hindi na option ng mastectomy, no? Kasi stage 4 na eh. So
hindi pa nung una, Doc, hindi pa. Piso pa lang daw yung nandun sa dede niya, piso pa lang yung bukol niya. What they did is to biopsy. So they took a sample. After that, bumilis na.
Okay,
so maabot na siya ng ganon, kumalat na.
Nakita niyo yung pasyente, stage 4 na. Masyadong
stage 4 na, yes.
Advanced na masyado.
So actually daw, meron siyang pinuntahan na clinic, kinemo daw siya. Nung lumala siya, hindi siya gumaling, nagka-singles pa siya. So pumunta siya sa PGH, ang sabi ng PGH, mali daw yung binigay na gamot sa kanya, na chemo. So sinabihan siya ngayon na magpa-chemo daw uli. Okay?
So, what
So in
happened?
short, may shingles siya dito, Doc. Mamaya pa kaya may ilabas ni F yung picture. Na matindi talaga yung kanya below the breast. May shingles pa siyang talagang matindi, makapal. So hindi yan F, yung ano yung babae, yung latest ko na pinadala. So binigyan siya ng gabapentin, yung gabatin, no? Gabapentin, anti-epileptic sa mga nerves ang function niya as pain reliever together with tramadol. So he's been taking all these these two painkillers ang regularly for every ilang hours ata yun, no? So napaka ano talaga, ang tulog lang daw niya,
Okay,
yan,
nandiyan na.
no?
Sir F,
Yan na.
okay, Sir Jill, nandiyan na.
At saka yung
Nag-mastectomy na ba ito? Nag-mastectomy na?
wala, Doc. Talagang nadurog yung dede niya kung tutusin.
Okay.
Yan, puro pas yan lumalabas
May
yan.
shingles siya din sa tiyan, ano?
Oo, andyan, no, yung sa baba na yan, shingles. May isa akong picture dyan, F, na talagang makapal yung shingles. Makikita niyo kung gaano. Yan.
Yan, masakit yan.
Yan ang shingles niya, Doc.
Very painful.
Masakit. Very painful. So, ang ginawa namin dyan, I gave him 2 capsules 3 times a day. Again, always with
So, 6
BCO.
capsules. Yeah, 6 capsules.
6 capsules, always with BCO, gargle, and then swallow. Tapos, itong mga ganitong may mga lesions na marami akong cases na mga ganyan, no? Yan, yung mga maraming cases na mga skin cases, I always prescribe 100 ml BCO mixed with 5 capsules of ivermectin at yan ang lotion niya.
Vapor niya.
Lotion yun 3 times a day or as liberally as possible. Pwede niyang i-apply. Actually, Doc, yung mga ganyan, Doc, talagang pumuputok ho yan, Doc, eh. And then lalabas, dudugo yan, puputok yan, and then nana ang lalabas niyan. So pinuputok daw ho niya talaga. Kung nahihinog. So apply niya, lilinisin lang niya, pinuputok niya yan. Pero magtataka ka, Doc, hindi na-infect. So
Kasi nilalagyan niya
yung
ng BCO with ivermectin.
plus yung oral pa niya.
I'd like to know what happened with the breast cancer. English.
Okay. Ganito kasi yan, Doc. Yung palang pagtitake niya dyan, in just a matter of 3 days, naalis na niya yung gabatin, no?
Gabapentin.
Sa pang-pain niya. Tapos bihila na yung tramadol, no? So what do we learn from here? That really ivermectin is an a strong anti-inflammatory at saka pain reliever siya. May painkiller, ano talaga siya. Ito, nakakatulog na ito. In fact, nireklamo ng mga anak niya na wala nang ginawa kundi tulog daw ng tulog.
Kaya tinago.
Anyway, hindi pa tayo darating doon. So, upon 2 weeks, makikita mo, marami pa akong picture, kinunti ko lang kasi nga pinagbabawal ni Ed daw yung iba, baka bawal ipakita. Nag-ano na siya talaga, actually, umayos. Ito yung mga hindi ko may bigay isang picture niyan sana para makita mo yung kabuuan, katawan, but kita kasi yung mukha, hindi ko ma-block yung mukha kaya hindi ko mapadala. Anyway, so 6 capsules, gumanda, nakakatulog na siya. Dati 2 hours and a half lang tulog niya sa buong araw, gabi, putol-putol kasi ang kirot ng mga ng shingles na yan, tsaka yung sa mga dede niya, no? Yung dede niya na wala yung hindi kinuna ng
Are you telling me nag-improve ang shingles sa BCO and ivermectin?
Yes. Marami na akong cases ng shingles, Doc, na napagaling.
Marami na po tayong kaso, Doc, niyan.
Kasi ganito, shingles, even before I came to know about ivermectin, BCO talaga ang gamot sa shingles. Okay, painumin mo siya tsaka papahid mo. Pero, I'm really very curious if it's really working against shingles. Kasi shingles is a chicken pox that has the card, ano? Kasi ngayon, lumalabas ang ini-issue nila, monkeypox. If it's working with shingles or chickenpox, then it has every likelihood na mag-work siya against monkeypox. Kasi parehong pox.
Indeed, Doc. Yes. Indeed. Kasi, Doc, hindi itong first time ko na may shingles na napagaling. May isa sa Bulacan. Much worse yun dito. Actually, may nagbigay ng picture, kaya lang wala akong picture doon ng before, kundi after. Talagang yung pati groin niya, hindi na makalakad. Abay, 1 linggo lang, Doc, natuyo.
Kasi nagte-take ng oral na ivermectin din.
Yes, oral at saka yung yung lotion na minimix ko 100 ml with 5 capsules ivermectin.
Pero I'm also curious about what happened with the ano. Can you relate to us what happened with the breast cancer this patient?
Okay, yung breast cancer niya, Doc, kung titignan mo yung meron pa ako ibang picture but I cannot show it eh. Kung napansin mo yung ghost na yan, Doc, tumutulo pang nana niyan, Doc eh.
So it's an
May
open
pas pa yan. Tsaka ang baho niyan, Doc.
Nalaglag na yung breast niya, parang ganon. Kasi
halos wala na yan, Doc. Puro bukol yan, Doc. Hindi siya hindi tinanggal yung dede niya pero lumiit na sa puro kumbaga nabulok na sa loob eh kaya tumutulo yan eh. Makikita mo lang yan, Doc. Tapos yung kaliwang bus niya na lumaki din daw kasi hindi naman yung kinuna ng biopsy, lumaki. Nung 2 weeks na siya nagtitake niyan, lumiit daw yung dede niya.
Ang dosage niya 6 capsules daily.
6 capsules daily. Lumiit na yon. Tapos yung mga bukol-bukol niya sa likod, alam mo yan, hanggang likod yan, Dok eh. Meron pa yung picture dyan eh. Sabi niya, nababasag o nadudurog na daw yung mga bukol niya sa likod.
Lymph node siguro yan, oo.
Hindi, marami, Dok. Maraming butlig-butlig.
Metastatic. Hindi.
Oo.
Yung sa shingles yung sinutukoy mo.
Hindi pa shingles, hindi shingles yan. Yung sa likod, hindi shingles. Yung shingles niya dito lang, Dok. So yung mga na yun, hindi pa shingles yun. Yung mga yun, kaya pag nakita mo talaga yung full picture na yan, makikita mo yung dede niya, puro bukol, Dok. Maraming bukol-bukol na yan. So makikita mo, lumiit na yung dede niya kasi nga lumalabas yung pus. Ibig sabihin, Dok, kinakain na yung tissue niya. Kaya lumiit na yung dede niya sa yung na-biopsy na area. Makikita mo parang medyo flat. Pero nung after 2 weeks, nawala yung amoy. Wala na yung baho, tsaka nawala yung pus. Wala na yung tumutulo, di ba nakita mo yung niya, yung nilagay niya na bandage? Just that is to hold the pus kasi para to absorb. May picture ako sa kanya na isa, hindi ko maipakita, na wala nang nakalagay na bandage. In short, parang nagsara, just the case with the diabetic na parang skin na yung lumabas doon sa dede niya na dati na tumutulo yung mga nana. That's 2 weeks. So, ongoing yan, Doc. Actually, we have a problem there.
What?
Dahil in-increase ko ng 3 capsules 3 times a day. Okay? Just to hasten. Kasi nga, Doc, ganito ang aking logic. I always believe about an effective rate. That's why I cannot give lower than that. And I have, so far, successful ako sa 6 capsules, no? So, why did I increase? Kasi nga nag-metastasize na po yan, Doc. Meron na yan sa ibang organ. So, kung we just superficial na titignan, yung nasa labas ng titignan mo, hindi natin alam kung ma-overcome niya yung mga sa loob niya na organ na pinasok na rin ng metastasis, no? So, I have to increase. And they're very, willing naman talaga. So, anong nangyari doon? Di tulog siya ng tulog. Panay ang murmur pag natutulog. So, natakot yung anak. Tinago yung ivermectin. Tinigil. So, yan ang mga isang mga gusto kong i-share sa inyo. Actual to, ha? Now, you have to really...
Jill, one question.
You really have to talk to the people that...
question siya.
Yeah,
one question, Jill. This person with the breast cancer, how long did you treat this person?
Ongoing pa. Mga mag-isang buwan na ngayon. 2 weeks pa lang yung...
Okay.
2 weeks yung may initial na result na sinasabi ko, pinakikita ko. 2 weeks lang. May initial result na.
So for 2 weeks, you are giving 6 capsules. Now you're giving 9 capsules after 2 weeks?
Binalik ko sa 2 weeks. Kasi ganito nga, Doc. So actually, may isa rin akong case na 73 years old na I gave him 3 capsules a day, which is 1 capsule 3 times a day. That's in Davao. Prostate cancer. Hindi niya may taas yung puwit niya, naka-diaper na rin yan. Talagang very weak. Almost bedridden, 73 years old. Nung makatake siya in 2 to 3 days lang, naitataas na yung puwit niya. And then after basta within the week lang, nakakaupo na siya mag-isa.
Jill, this last one that you talked about, this is very important. This is a very important case. Can you just make a very short report on this case? Tapos i-post mo because this one is very important. This thing of 1 week, a man with cancer takes ivermectin and is able to lift his foot. We have to explain that. In Spanish, contundente. Ang tawag sa contundente sa English, yung undeniable yan eh. Isang linggo parang nakakatas na yung foot niya. Can you
Hindi,
imagine
2
that?
days lang. Naitaas yung puwit.
That's even better. So these are the kind of testimonies that are very important to allow people to say, may cancer ako, give me the ivermectin, I will try it. Kasi yung mga kaso ng mga cancer na, for example, yesterday, there was a doctor from the US talking about a patient, 73 years old, metastasis in 3 organs. Prognosis is 3 or 4 months. 3 or 4 months yung prognosis.
She's dead.
So,
When you say
malapit na
prognosis, he's dead
mamatayan.
after that, apa.
Malapit na mamatayan. So, what is there to lose? Birahin na natin ng ivermectin yan. Baka sakali, di ba?
Yes.
We will mo kagad.
We'll discuss, Manolo will discuss that privately because we have to ask question first kung anong mga scenario, anong condition, etc.
Okay,
blah, blah,
okay,
blah.
no, but
We can discuss that.
What I'm trying to say is that case, we have to make a simplified, summarized
Case study.
case to say it. This is
Case
what we're
report,
doing.
yeah.
And this is,
Okay.
because, ang ano yan eh, parang can you imagine, sabihin mo ako, no? Sabihin natin 73 years old, I have cancer, I have metastasis, the doctor tells me I have 3 months to live. Di ba? Anong gagawin ko? Tingnan mo sa akin yung ivermectin, baka sakali, di ba? Di ba? So, it's time is precious, wala tayong panahon eh. Wala na tayong discuss, basta itong ginawa namin, ito nangyari, kung gusto niyo, tirahin niyo, di ba? I think this should be the approach eh. And
Yes.
this is how we can learn eh.
We can do that. Kaya nga, kung partner, Doc, that's why I'm very insistence on us meeting to discuss all this and then, you know, kaya nga inaano ko itong kita, tsaka pati yung case din ni Doktora Aisha. Bakit matindi din yun yung kay Aisha.
Yeah.
Hindi
With all
biro
the
yun.
cases that we have, ito, pati yung sa Davao na sinasabi
Yes.
mong prostate cancer, what we can do, hindi mawawala yung material na yan. We can do a case report on each one of them. And it
Yes,
can
yes,
be published in scientific journals. After that, then we do a clinical trial study. Na
Yes.
talagang binabantayan natin lahat ng parameters and everything. But
Yes,
all the other cases na nauna, na hindi mo access yung material niyan, we do a case report. Then we have to
Especially event, this is very important because people will get ideas eh. Ang dadami yung the people in the group now, may mga doktor na hindi, not all of them are urologists, may sari-saring klaseng doktor dyan, no? But once they start seeing this, they're going to get ideas eh. Kasi the idea of what we're doing is we want to open people's minds. Hindi pa nila alam yan eh. Yung iba hindi pa nila alam kung ano yung ivermectin na yan. Ano ba yung ivermectin na yan? Ano ba yan? Pangkabayo ba yan? Ano ba yan? Di ba? Because
Actually,
yung mga doktor, hindi sila naniniwala na something as simple as ivermectin, 40-year-old medicine, will work for so many things. Hindi sila naniniwala. I want to tell you something, no? That just for you to understand a little bit. Here in Spain, the doctors cannot prescribe off-label. Pag hindi nakalagay nakalagay sa literature ng gamot yung pwede, hindi nila pwedeng bigyan. So in other words, if today I invent aspirin today, okay? I have applied, my original application for aspirin was only painkiller. Nobody could test it to see if it was good for bringing down fever or as a blood thinner. Hindi natin alam yan. Bakit? Because the protocol is made like that. So it's corrupt. Hawak ng mga pharmaceuticals lahat yan.
That's a big pharma.
So
Actually,
this is why this thing that we're doing is revolutionary because we are forcing. But there is an exception in Spain. May exception. In Spain, there is an exception wherein a doctor can make what they call a receta magistral. Ibig sabihin doon, under my responsibility, I will make a prescription because I think this is going to work. But I will be the one responsible. Pero sino yung matapang na gano'n? Saan yung mga doktor na matapang na ganyan? Si Dr. Landry
Bihira.
yung matapang na ganyan. You see what I mean? Walang ibang kukuantring mga matapang, di ba? Kukuantring yung mga matapang. So this is why this is so important. We don't have time. We have to bring this out right away. Please lang.
At saka, Sir Manuel, hindi mo matatawaran yung tapang ni Doc. Kahit anong pananakot nila. Oo, binabantayan pa yan ng mga, yung mga uniform personnel, ha?
Alam mo,
Dalawang truck, o minsan isang truck. Hindi na
Kubintang.
Alam mo, Fred.
Oo, nasa bahay lang siya.
Alam mo, Fred, yung matapang, hindi nagsasalita.
Yan, tama. Oo.
Di ba? Basta yung matapang, hindi nagsasalita. Quiet lang. Di ba? And this is why the work of Dr. Landrito and the work of all of the other doctors who have followed Dr. Landrito is admirable. Admirable. Kasi and there, I read recently, when we search for the truth, we search for God. Remember that. When we search for the truth, we are searching for God. Bakit? Because God wants everything to be known. And that's all we are doing. We just want other people to know and to choose. We're not telling everybody, take ivermectin because it works. No. We're saying, we think it works. These are the cases that we have to present. Take it if you like. That's what we're saying. So, we have to be thankful to God for bringing us Dr. Landrito, who's matapang.
By the way,
Dr. Alan Diyan ako bilib ni Dr. Alan Landrito dahil kahit marami ng pagbabanta, pagkatok ko sa umaga, pag sinag ng araw, nakangiti pa sa akin yan.
Alam mo bakit yan? Alam mo bakit yan, Fred? Alam mo bakit yan? Gwapo siya eh.
Kaya,
gwapo si Dr. Landrito eh.
Ano pa yan? Oo, hanggat nagkukwentuhan kami, nag-aalmusal kami sa bahay niya, nakangiti pa rin siya. Pero napagkarami na ng mga treat sa kanya nung panahon na yun.
Yung satisfaction, no? Yung satisfaction sa...
By the way, before I forget, I can summarize yung result doon sa amputee. You know what? Ngayon, wala na siyang tinitake na insulin whatsoever. Nasa na siya, 110 ba? Mga 95, 80. Mga ganun na lang, 90 something. Less than 110 na siya. 105, 95.
You're saying you're suspecting it's even an anti-diabetic, ha?
Doc. Tingnan mo na. Let me finish. I'm not making that jumping to a conclusion, but he's also doing this so-called na lang na what you call this, parang intermittent fasting yung ginawa niya. So, niya. Pero the fact is, remains, na kung kahit pa siya mag-fasting, dapat ma-hypo siya kung diabetic pa rin ang condition niya. Right, Doc? Mag-hypo ka kapag mag-fasting ka. Kung diabetic ka pa rin, ma-hypo ka eh. Hindi siya na-hypo. Meaning to say, bumalik na yung kanyang function ng kanyang ng liver.
What you're saying, Jill, is it may have normalized.
Yes. So, hindi pa rin natin masabi, but of course, you have to watch out also. Hindi ibig sabihin na bumalik ka sa dati mong gawain, na laklak ka dito ng mga bad sugars, bad oils, kasi yun ang inalis ko sa kanya. By the way, Manolo, once we discuss our treatment here, we always do the first thing. Remove the bad oils, remove the sugar, especially the white sugar. Parati kong ini-emphasize yan. Kaya nga kinakausap ko lahat ng mga possible na mga subjects ko eh. Remove first these two. And then saka natin yung medication. So there's no hindi to jumping lang ng kung ano-ano lang. Okay, take it, etc. No, we don't do that.
Oo, sa ganda ng usapan natin, kaya lang medyo lumampas na po tayo sa oras. Siguro, bigyan na muna natin sa susunod na pagkakataon yan. Bigyan muna natin si Sir Manuel Gonzales na magsalita. Kasi medyo lumampas na tayo ng 9 minutes eh. Sir Manuel?
Thank you very much for the opportunity. We have plenty of work to do. And we can only say, continue the fantastic work. Salamat sa lahat.
Okay. Dr. Landrito?
Yeah, I want to continue what we left out nung huli natin. The concept of conventional medicine is once diabetic, always diabetic. It's not true. Today, with nutrition medicine, we can reverse diabetes. We can reverse metabolic syndrome. No? Yung binanggit na niya, yung intermittent fasting, that's one aspect. There, you have to correct diet in many different ways, like keto carnivore diet and all that, intermittent fasting, depending on the case of the patient. So, nutrition medicine, mako-correct natin yan. Ano? And of course, ang pinakamatinding pinakamatinding challenge natin are the vaccine injuries. No? So, medyo mahirap na case yan. Pero, we can help a lot of people in different ways.
Okay, thank you, Doc. Partner?
Partner, Kalikasan,
Kalusugan.
magandang araw sa inyong lahat.
Sa susunod na Miyerkules uli, at
Okay.
kasama natin si Ma'am, ipagpatuloy natin yung episode natin sa kay Vanessa next Wednesday.
Depende kay Doc kung is it important for us to proceed with all these sa mga cases ng mga cancer na i-discuss natin, pwede nating isama si Dr. Aisha. So, kasi ang momentum kasi ay parang ayaw ko rin na iputulin para marami tayong matakil na cases. Kasi tulad ni Manolo, may sinabi siyang 59 years old na ganitong case at saka isang ganun. We can collectively make a proper recommendation. So, anong tingin mo, Doc? Ano sa tingin mo?
If we can get Dr. Aisha, next Wednesday, if we can get Dr. Aisha, it would be good if Manol is also will be with us.
Yeah.
I won't be able to. Next week hindi ako pwede. Next week hindi pwede. Maybe the week after.
Okay.
Okay. So
Kailan po kayo
we just send.
pwede?
Siguro next week hindi pwede. Yung isang week pwede.
Okay. Doon na lang natin ipagpatuloy yun. Siguro mas maganda si Vanessa mo na siguro makasama natin.
Para yung part 2 ng kanyang breastfeeding.
Part 2. Yung sa breastfeeding.
So next week.
Okay, sige. Maraming
Okay,
salamat,
bye-bye.
Luzon, Visayas at Mindanao at sa lahat ng sumusubaybay sa aming programa. Sa tuwing Miyerkules, subaybayan niyo po kami sa aming programang Kalikasan.
Kalusugan!
Bye-bye.